Good afternoon. It is Monday, August the 16th, 2021, and we are here for a school board workshop agenda. We have Ms. Fisher is on the line with us. The time is 1:01. She is on her way in, but in the meantime, she will be with us via the phone. Ms. Giovanelli, I believe, will be here shortly. But we will go ahead and move forward. The order of business today for the workshop, Ms. Fisher, if you can please make sure that you mute yourself while you are online, that'd be wonderful. So that way,
yes, ma'am.
Thank you, dear. The purpose of the workshop today is the Lee County COVID-19 situation report, the elementary proximity plan update, part 1, and the agenda review for August 17th, 2021. So we're going to begin today with the Lee County COVID-19 situation report. And if you will please introduce yourself. Well, we know Ms. Please
Hi.
introduce yourself.
I was going to go ahead with the board's indulgence. Good afternoon, board and Dr. Savage and Ms. Dupuy-Bruno. My name is Lauren Stillwell. I have with me Ariel Ganem, who's the Director of Communicable Diseases from the Florida Department of Health in Lee County. And then on the line, we have Dr. Stephanie Stovall, Pediatric Infectious Disease Specialist and Interim Chief of Quality and Patient Safety at Golisano Children's Hospital. So both of them are going to give you kind of a brief situational update regarding COVID-19 in Lee County, and then we can open it up for questions. So I'll turn it over to Ariel first.
Hello, good afternoon. Thank you for having me. I'm first going to provide you with an update regarding the current state of COVID-19 in our community. Last week, there were 5,585 new cases of COVID-19 reported in Lee County. The new case positivity rate last week is 24.6%. This indicates that the level of community transmission is high. We are continuing to see an increase in the number of new cases, which is a consistent trend across the state and nationwide. Currently, 62% of the population in Lee County who are eligible for the COVID-19 vaccine, which are ages 12 and older, are fully vaccinated.
I'm sorry, can you repeat that last thing?
Absolutely. So currently, 62% of the population eligible to receive the COVID-19 vaccine, which are ages 12 and up, are fully vaccinated in Lee County. And that completes my report for this morning, or this afternoon. Thank you.
Dr. Stovall, if you can hear me and you're on the line.
I am. Thanks, Lauren. So I'm here representing Lee Health and Golisano Children's Hospital. We currently have 550 patients, a few more than that, admitted to our facilities. Typically, we are having between 10 and 17 pediatric admissions to Golisano Children's Hospital every day for the last week. Our emergency departments are busy, seeing between 800 and 1,000 patients a day. That does include Golisano in the midst of that, and pediatric patients are seen at all of our facilities. At this point, our main messages to the public include masking, especially for children who are ineligible to receive vaccine because of age, and also for vaccination for every eligible child. Our pediatric mobile vaccination clinic is still active. That ends my report.
Thank you. Ms. Stillwell, is that okay for us to ask in between, or would you prefer to finish what you're going to say and then ask?
Nope, that was it. So we just open it up to
Ms.
questions.
Gittens was first, please, and then Ms. Vaughn.
Okay, good afternoon, ladies, and thank you for being here in person and online. Of the 62% in the county that are vaccinated, that's everybody?
The 60,
That's all ages is what I'm saying.
all ages 12 and up, yes, all those who are eligible to receive the COVID vaccine.
And
in
do
Lee
we
County.
have that broken down by children?
I don't have that information with me today, but I'd be glad to find that out for you and provide that to you at another time.
Okay, and then of the, you're saying 10 to 17 children per day is what the other lady said. What is that increase from like a week or two ago?
So a week or two ago, we were seeing somewhere between 2 and 4 admission, or 2 and 4 admitted to our facility at the Children's Hospital every day. Back earlier in the pandemic, it was rare for us to have more than 2 in the entirety of Children's Hospital being admitted at any given moment. So this is a significant increase. Last week, our peak was at 17. I believe this morning it was at 11.
The what's the word for it? Severity of the children, like how long, if they come in, how long are they usually there?
So the length of stay for all patients is around 6.5 days right now. We have 2 different types of presentation in children. One is acute COVID, and those patients, depending on how severely ill they are, can be with us for just a few days to approximately a week. Patients who have the multi-system inflammatory disease that comes a couple of weeks after COVID, those patients tend to be with us longer and are with us for a week or a little longer because their presentation is different and is typically a febrile illness that requires prolonged treatment with an antibody-based therapy.
Of those 10 to 17 that you had last week, some of them are going to potentially come back with the inflammatory disease, illness?
Yes. Prior to this part of the pandemic, this surge, the vast majority of the patients that we saw with COVID had what we call multi-system inflammatory disease, which is occurring typically somewhere around 2 to 6 weeks after COVID infection. So most kids prior to this Delta surge were not hospitalized with acute COVID. They would just have the inflammatory process later. Unfortunately, with Delta, we are seeing more with the respiratory illness acutely, and we are now starting to see the multi-system inflammatory disease after infection with Delta as well. So we anticipate that that group will grow as we get further and further out into this Delta surge. And hopefully at the same time, if Delta starts slowing down, we'll see fewer of acute COVID in pediatrics. But we haven't peaked there yet.
Final question I have is the MSI disease, is it contagious at any time?
So after recovery from COVID, when you have acute COVID, around 10 days after your first symptom, your contagiousness to other people stops. Now, unfortunately, other people around those children may still be in the acute phase of their illness, so they could still spread it to other people who are vulnerable. But the multi-system inflammatory disease that is post-COVID is not contagious. However, there are other illnesses that can mimic it, some of which are contagious, so we are very careful in that situation to be sure that we're not still spreading it, and those children are not well enough. Sure.
Betsy, I'm sorry, Ms. Vaughn?
Yes.
And Ms. Morgan, and then Ms.
I'd like to go back to the number that you gave for, I think you said fully vaccinated, 62% in Lee County?
Yes.
Okay, that number is significantly higher than what is presented on the local news, and I've been watching it very, very carefully. On the local news as of a couple days ago, I'm just going by memory, I think it was something like 47.8%, and of this, the Tri-County area with Collier, I think, was at 55%, and Charlotte was, I think Florida at that time was 50%. So how do we, where did your numbers come from? And are those numbers perhaps including from still back in season, the seasonal older population?
So the 62%, that was the percentage that was reported in the COVID-19 weekly situation report, and that was on this past Friday, the 13th. That was when those numbers were reported. And that is for all Florida residents 62 and 12 and older.
Florida, actual residents, not
Residents.
people that, okay, so what site is that? I'm just wondering how to
Sure.
reconcile what they're showing on the news versus,
Sure, it's on our Florida Department of Health website.
I can send you the link.
okay, and is that the website that, I don't remember, I know there was one website which discontinued publishing, I believe at the governor's bidding.
So yes, so they did go back, they transitioned from doing daily reports to a weekly report that's published every Friday. So a new report will be published this Friday with updated numbers.
Okay, and it really would be helpful to know ages, at least the senior population, because as a senior population member myself, I know that when you look at the number of the 65 plus, it's a really, really high percentage of people that are vaccinated. I think probably a trend across Florida and maybe the nation. But when we're looking in our schools, certainly there are some teachers, administrators that are 65 plus, but it would be a rather small number. So is there anywhere that you know of that breaks down that number that we could look at?
So I know CDC does have that data available. They break it down from 18 and up and then 65 and older.
Okay.
And they do it county specific. So CDC does have that information, but we can always get a breakdown of the age groups at another time. Unfortunately, I don't have that information.
Yeah,
with me
no,
right
I'm
now.
not asking for it right now, but I'm just thinking, as we, as a school district, look at our schools, that it's more important for us to really focus on the group between 12 and 64, because the 65 and up are going to be a minority, and I think that would tell a much more accurate situation on what we're looking for in terms of threat. But thank you for sharing that information.
Sure, of course, absolutely.
Okay, thank you, Ms. Vaughn. Ms. Morgan, please, and then Ms. Patrica.
Yeah, so I'd like to know how many children, we're 1 week into school, so how many children are out and how many teachers are out with respect to COVID. Is there a do you see a correlation between the start of school and the spread? Last year, 2021, our transmission rate was low in our schools. I don't know what the transmission rate was in our elementary schools. That's where our risk is right now. What is your projection with respect to ongoing transmission and et cetera if we do not do a mask mandate in the Lee County School District? Anybody willing to step into that?
So I can, on Friday, we had, as for students and staff, on Friday, we had 585 students and staff isolated or quarantined per the DOH.
Is that cumulative?
That is on that day. So you can't really do cumulative because people fall off, because like you might, if you have a 10-day isolation and then you're at day 11, then you've had people falling off, but then from day 6 you have people add on. So so that was as of that day, 585. And then I will let Ariel talk about transmission and Dr. Stowe will talk about the students or if anything else that she might have from the hospital perspective.
Sure. So I know that we do have an increase in the number of new cases, and it is consistent among the state and nationwide. According to CDC, 83.6% of U.S. counties are at a high level of transmission, and we did see these numbers before school started. As far as the masks, I'm going to defer that to Dr. Stovall so she can discuss that from a medical standpoint.
Sure. So from my perspective, what we are seeing is definitely high transmission and continued increased growth in our facilities. We've done internal predictions based upon the numbers that we're seeing. They're done system-wide, so it's hard to break that out to just pediatrics. But looking at the numbers that we were seeing lead up into school starting and knowing this virus and the potential for transmissibility, I have high concerns that we're going to continue to see transmission. We also have evidence that that's occurring in other states that start school earlier than us. So from a physiologic perspective, from a biological perspective, I am concerned that people not wearing masks in our community right now is very dangerous for anyone who is vulnerable to this virus, meaning they don't have protective immunity. And we know that vaccination is the best immunity. Even though we can see breakthrough disease with vaccination, they're unlikely to be as sick. And so those who don't have vaccination immunity are at the highest risk of hospitalization.
Ms. Morgan, did you have any? Good, thank you. Ms. Patrica?
So we have all, I'm speaking to my colleagues now, we've all received, I believe, I know I'm receiving them, I assume you guys are copied on them, an increase in the number of emails and people reaching out to us asking us about masks. I received a text message from a constituent in my community who's really have always had fantastic interactions, ask questions, provide responses, get a little pushback, agree to disagree, that kind of thing. The text message said, "Am disappointed that Lee County School District website leads, all caps, leads, with a large link to opt out. Last year, it took about 6 days post-exposure to be notified. Now that we're seeing like 50-fold increase and less resources, it's likely no one will be notified in a useful period of time. 130 cases last year at EHS, now 10 in the first week. You know the mortality rate and the under 18 vax rate. The risk of a truly horrific outcome is not insignificant." And the last line was really the one that hit me the hardest. Please do something. And that's what I'm hearing from my constituents. And I want to know, if I may direct a question, Madam Chair, to the superintendent and to the board attorney, what are we within our legal rights to do to provide increased protection to our students? But I'd like that question to be answered after I direct a question, two questions. Number one, 62% of people over the age of 12 are vaccinated. People in Lee County altogether, what's the vaccination rate, including those under the age of 12, please?
I don't have that information with me. I only have the data for those who are eligible to receive the vaccine.
Okay, well, I mean, it's obvious from a numbers perspective.
Oh, actually, I believe that I do have.
Okay.
I apologize. I actually did bring that with me. For the total population, disregard. I can get that information for you, though.
That'd be great.
Absolutely.
The number is going to be lower than 62,
Of course.
obviously, if you're including those who are not eligible to be vaccinated. I believe you have to be at 80% to get to herd immunity, and we're nowhere near that if we include our under 12s.
Sure, absolutely.
So herd immunity is not an option for us anytime in the foreseeable future. I failed, sorry, I just threw a question at you, Ms. Ganem, and I didn't thank you for being here. Dr. Stovall, thank you for being here. I do have a question for you. Would a mask mandate in schools be safer for our students and our staff?
In my medical opinion, yes, it would be.
If I could direct the question to the superintendent and the board attorney, what are we within our legal rights to do to protect our students and our staff?
think we'll just try to take each piece of that from our perspectives. So the governor did issue an executive order. That executive order, to my understanding, is basically saying that we cannot mandate masks in our schools. While there are penalties that were originally proposed, those penalties have changed. And so I would say that the executive order remains the same. The governor has made that statement, as well as my understanding is the State Board of Education is looking at districts who are non-compliant to that particular piece. Initially, it was told they would withhold funding, but then that changed to say that now they would, as just sanctioning for us to be aware of, for if any school board or district were to ignore that executive order, that they would potentially withhold the salaries of the school board and the superintendents in such offending districts, again, with whatever additional action that the State Board of Education is looking into, specifically as they've noticed that they're going to be looking into districts that are non-compliant and what additional actions. We did receive from Secretary Cardona from the federal level a letter essentially to let us know that if districts were to go against what the governor has issued in terms of the sanctioning piece, that we would be permissible to use ESSER funds to offset those salaries if that were something they were looking to do. Some other districts who've already kind of taken that position have also said that they are doing fundraising efforts and things along those lines. All of that kind of ignores the real piece of it, which is that the governor did in fact put that executive order out in conjunction with the State Department of Health to kind of outline what our policy, what his expectation was in terms of our policies and how we balance masking with parent rights. So I just kind of want to outline that piece. In terms of legalities of going against an executive order, would you be willing to share
So
that?
there's a couple of things for the board to take into consideration. So we are with the ability to have local government and local control, with the executive order that basically says that you cannot mandate masks, and there's statutory authority that says that you must follow the rules as issued by the Department of Education. So that's the quagmire that we're in. The Department of Health issued their rule on August 6th that essentially says, and this is what the executive order required, that the Department of Education and the Department of Health issue some guidelines for school districts to follow. So the DOH did issue those guidelines and indicated that masks may be required so long as the parents had an opportunity to opt out. And that's what we have done. Some of our sister districts have taken it a little bit further, where they have required a medical note for those opt-outs. And that is what has triggered some of the responses from the Department of Education saying that there is going to be an investigation as a result of a violation of the spirit of the executive order by requiring the medical note to opt out. Where are we now? It's a quagmire. It's very difficult. We have some districts that are planning on challenging the rules. One district has already indicated that they will be challenging the rule. We have some districts that have indicated that they're going to continue on with their mask mandate unless you have a medical documentation to opt out. And then you have some districts that have basically done what we have done, which is require a mask with an opt-out that does not require the medical condition. So how they were planning to enforce the governor's executive order was to basically take the superintendent's salary as well as the salary of each board member, and there were some discussions as to how the governor could actually go into our payroll to do that. The Department of Education answered that question by saying that it would be through funding. So we would withdraw the equivalent of the superintendent's salary and board member salaries in the funding. There's been a softer stance now that it's not, I don't believe it's going to be the full salary. And then again, the United States Department of Education has indicated that it will supplement whatever is being taken out by the governor or the DOE with additional funding. So that's where we are. Can the board, from a legal standpoint, decide to do a mask mandate, it's definitely within the purview of the board, with the understanding that there will probably be repercussions from the Department of Education and the governor for taking that stance.
And can I just ask too, if we can have, because I know we have two guests here, one's on the phone and one is sitting here. So if we can address any questions that they would have to answer, and then if there's anything else that we would like to discuss further about situations, we could maybe hold that until after they are finished, because I know they have times. But go ahead, Ms. Patrica.
This is educational, not medical, so if you could come back to me.
Okay, I will, thank you. Ms. Giovanelli, do you have any questions for our guest? Please.
Thank you for being on the line, Dr. Stillwell. Right?
Stovall.
Stovall. Sorry, apologize. Okay, so one of my questions is regarding should schools remain open, or would you recommend us to maybe shut it down for 2 weeks until the numbers go back down? Second, we only are talking about masks, but the guidelines were also the social distancing as well. So I think it's vital that if we're going to follow the guidelines, we need to be vigilant on all of them. And secondly, what do you think about sports? The contact sports are all going on in the buses and stuff like that. So there's still that difficulty in social distancing. So what's your recommendations there?
Sure. So I'll take the first question first about whether or not we should close schools. And I'm freely going to admit that I'm a pediatrician first. That was my first career. And I recognize how important it is for children to have social interaction. And probably early in this pandemic, we saw much more damage to our children from their lack of schooling in person, from a mental health perspective. So that would be a last resort for me. Unfortunately, what we're predicting is that this surge is at least going to last another 2 to 3 weeks. So I don't think that just 2 weeks of pause would be enough to slow things down and make it safer for kids to be in class, close together, without protection barriers in place. The best protection is that everyone wears. Social distancing is important, but it becomes less important if everyone who is breathing is wearing masks. So if they are all wearing masks, to have them sitting, 4 or 5 feet apart, even 3 feet apart, is probably fine if they're wearing their masks appropriately. School buses, again, they're going to be really close together. If we could spread them out some, it would be good to do so. But again, they need to all be masked. Where you have a few individuals who are not, that's where you're going to have a break that protection. Contact sports are a concern. Many of those sports, it's impossible to do with a mask in place. So from my perspective, especially if those are indoors where we don't have the benefit of our outdoor wind and atmosphere, then I think that it is a high risk, and I avoid that for at least a few weeks until the surge passes.
So you're saying that all masks work?
Masks work if they are covering the nose and the mouth, and if everyone wears them. They are more protective externally facing, meaning you get more protection from me wearing my mask. Likewise, I get more protection from you if you're wearing a mask. I do get some protection just by wearing the mask, but I'm protecting you even more by wearing it.
So one more question too, please, and thank you. a lot of times when someone has COVID, they're not presenting with any symptoms. So that's why you're recommending the masks. Is that my understanding? Because, I mean, my theory is that students, if they're sick, they should stay home, and as well as teachers and staff and so forth. But are we seeing with this Delta variant the same symptoms, the asymptomatic, where people are not aware that they're carrying the virus?
That's correct. Yeah, that's correct. You will have a period of time before you become symptomatic. You won't know that you're spreading the virus. And that's why masking at all times is important, because it does protect those individuals around you before you even have an idea that you're spreading it. It's also why contact tracing is very important, and why we are so grateful to our Department of Health colleagues of helping at that, even though it is a huge ask, because it does help us keep people protected by telling them that they are at risk. And yes, they should stay home if they have any symptoms at all.
Thank you.
Thank you. Ms. Fisher, did you have any questions?
No, I just want to thank Dr. Graham and Dr. Stovall for being here and providing this information from the medical standpoint. It sounds to me like the simplest, most effective thing is for us to require that everyone have a mask on, and kind of like wearing a seatbelt when you're riding in the car, or wearing a helmet when you're riding a bike. However, the mask, as you just described, will not only protect the individual, but those around them. So I thank you for that information, and I'm glad that we're having it publicly. Thank you.
Thank you, Ms. Fisher. And I know Ms. Gittens had one more question, and then Ms. Vaughn, please.
Yes, I mean, we've heard a lot about the reporting, and I, like Ms. Vaughn, I listened to several different news medias and compare for myself. However, I think part of our issue is reporting actual real-time numbers. And as a parent, I would think some of the parents that are iffy about doing it, to see the actual real-time numbers might help some of the people that are resistant to the crisis that we're in, to understand the gravity of it. And yet, I know from even last year when we were at 10%, and now we're at 24%, but I've continued to ask, how can we know exactly what's happening, what time? I know there's HIPAA laws and all of that, but I don't think parents or anyone is asking for anyone's name and where they live, which is what HIPAA has to do with. But to know that at this school or in the 5th grade, we had 5, cases today. And then the other part of that is when you mentioned the 585 that were isolated, how many of those were actually COVID cases as opposed to just isolated because of? So, I mean, that proves what I'm saying. We get the number saying there's 585 isolated, but we still don't know how many of those are actual COVID.
So as I shared last week, we did see a mock-up last week of what a COVID dashboard is going to look like on our website, and they would be updated every day with the real-time numbers once a day of how many cases would be in the schools, and then there would also be a cumulative from August 10th. We're hoping to have that up and running in the next couple of weeks. We're working with our IT department and health services as well as the communications department. It would be embedded right into the district website.
So Dr. Stovall, is there anything that 2 weeks is a critical point in time to get something up there. Is there anything that you all have that we could share in that could help people know this is happening right now?
Absolutely. We have a team that works on messaging to the media, and I can have them send you our material. And we can also send our material having to do with pediatric specific, even though we want to note that it's really a concern about your staff members as well.
Thank you, and I would hope that my colleagues would consider getting something out there sooner than later to let people know how grave this is.
Thank you, Ms. Gittens. Ms. Vaughn and then Ms. Patrica.
I think I know the answer to this, but I just want to be sure. Talking about the surge and timing, we know from past events, for instance, following the 4th of July and various super spreaders, we know that it's normally, about a week to 10 days after those events? Is that the right time frame?
Typically, something like that could be a little faster, but usually we're not out of that window.
Okay, so yeah, you know where I'm going with this. The teachers have been back now for a couple weeks. They're going into week 3, and the students going into week 2. So we can unfortunately anticipate that the surge is only going to go much higher when those numbers from those first couple weeks are calculated. And also we need to remember that we have a whole community out there that's, people coming to Florida to celebrate Labor Day and families getting together. So we really have a 3-week period starting right now that's a huge danger zone. So is that within the realm of reason, what I'm saying here?
I believe so, and I think that, we just want to ensure that parents and guardians are, keeping their children home when they are sick, when they have symptoms. We know COVID has a large range of symptoms that could be very mild to congestion, thinking you have allergies or a mild headache. I would say even at that point, keep the children home, see if it's COVID. Get them tested and see. We don't want to keep healthy students out of school, but if there are mild symptoms that you think could be allergies or a headache, I would just say that, get them tested to make sure, because a lot of times we see, we think that, it's just allergies or whatever it is, and we ignore that. So that would be my message to all the parents and guardians.
Okay, because personally, the next 3-week period to me is a very worrisome time. And then the other thing is watching not just Dr. Fauci, but some other medical experts on the news, their opinion on how to protect our children under age 12 who are not eligible for vaccination is, A, to surround them with vaccinated people, which would mean school personnel, bus drivers, teachers, etc., and their parents, and to have everyone wear a mask. Not foolproof, but I've even seen from other states statistics. One of the governors, I don't remember what state, was saying, here's one school district, they had these protections. Here's another school district in our state, none of the protections, and the numbers that governor gave were quite disturbing in terms of the rate of transmission. So whenever we get to the point that we can bring something forward, I definitely, and I'm kind of hearing Ms. Patrica and maybe some of my board colleagues wanting to see what we can do to better protect our children, because we're hearing it from medical professionals here, and they can, I believe President Biden has come out, and I guess maybe, was that it, Dr. Savage, what you were quoting from the U.S. Education Department, that
Yes, through the chair, Madam Chair, the Secretary Cardona, who is the Secretary of Education for the federal government, so that would be under Biden. It doesn't come from Biden directly, though Biden did make some comments to the effect that against kind of Governor DeSantis' stance. But from a letter standpoint, in terms of addressing the requirement, that came from Secretary Cardona.
Thank you.
Okay, and then, Ms. Pacheco, did you have another thing to ask them?
Yes, let me find my question. Is there a point, Dr. Stovall, at which masking would not be recommended? For example, Bishop Verot will be using, I'm sorry, not Bishop Verot, the Diocese of Venice will be using 10% community spread as a barometer for their schools. Can you provide similar guidance?
Yes, typically we would use around 10% community spread and say that people who are vaccinated or immune would be safe without masks at that point. That's assuming we don't have another variant that comes through that would change the course of the surge.
Okay, Ms. Giovanelli?
Yeah. I'm sorry, Dr. Stowell. One question that I was concerned or was asking, how many children are in your care at the hospital right now that you're treating for COVID? You might have said it, but I
can't give you an immediate number. I can tell you it was 11 this morning. We had 550 in our facility system-wide this morning, and it was 591 10 minutes ago. So I can't tell you what has happened with Golisano in the last 4 hours. I haven't checked. But it was 11 this morning.
11 admitted this morning.
Admitted, yes. Our ED.
So at about that time, it was 591 children being treated at Golisano.
If you give me, I can move and you can park.
If you give me what?
No, I think
she's talking to somebody else.
She's moving her kids into an apartment
Oh.
while she's talking to us.
I understand.
So did she answer your question, Ms. Giovanelli?
Well, so the question, 11 this morning, but 591 about that same time, I think, right?
Correct.
Okay.
It was 550 and it went up to 591. And 11 was admitted.
I don't know. I don't know if she's
Dr.
still on.
Stovall, are you still there?
Might have muted, maybe.
If you have any other questions, I can write them down and try to give her a call after this and try to get the answers.
Okay, so what would the question?
What is our max capacity? That's really what I was going to ask.
The max capacity for the
I
hospital?
mean, are we considered almost full? I mean, so what does that mean? How many beds do we have? I mean, I'm just kind of.
I'm sorry, I missed part of that. You asked how many beds we have?
Capacity, like, that you could treat.
Sure. So Golisano total has 137 beds. That includes our neonatal ICU, our PICU, and our med-surg floor. We also have alternate care sites that are available should we need them because of surge, which would increase our capacity by another 10 to 15. Realizing that would shut down our recovery areas from surgery. We will also have some capacity potentially off-site. We are looking at alternative care sites for the system because we are over 95% capacity for Lee Health in general. And so we are having to look at alternate care sites for patients who are not as severely ill.
Thank you.
And Dr. Stovall, I believe they're already using some of those sites. Are they not utilizing some of them in different hotels, et cetera, where they're hosting these, the patients?
I don't believe that Lee Health itself is using any hotel spaces at this point. We have opened some sites that had previously been set aside to be shut down for renovation for movement of our trauma program, and we've had to reopen those and delay that renovation. But we don't have hotel sites open at this point. We are only opening internal sites and putting patients in areas that would not have previously been used for patient care.
Ms. Patrica, you said you had another question?
I don't know, Dr. Stovall, whether you can speak to this or this is more appropriate for district staff, but are you aware of a social, emotional, or developmental issues associated with children wearing masks? Does my question make sense?
It does. I can only answer from the medical side of things. No, the vast majority of children are not going to have any long-term damage, either physical, emotional, or mental, associated with just wearing a mask. If they're socially isolated, they could have some mental or emotional concerns, which is what we saw last year when kids were not being able to be in person at school. So those things could occur, but from the mask itself, no.
Okay, thank you. And then I had some questions. I know I had looked at the COVID-19 incident log, and when I looked at that today, every one of our schools, with the exception of 9, have cases right now, based on the information that is shown here. And of those 9 schools, only the smallest schools are the ones who do not have any cases, where they might have 2 or 3 or maybe 6 kids in those classes, or in the schools, period. So they don't have, there's only 2 that are full schools. But I think, and when you're looking at that, that is pretty scary when you're saying that all of these schools now do have cases in there. So I think that if we can try to launch that site up sooner than later, I have to agree with Ms. Gittens on that. I think that that would be something that we really need to do for the dashboard. And I know just one school today had 14 teachers out. What do we do with those 14 teachers? Now we're taking all those students, and instead of we're packing them into the other classes, which is creating what we're trying not to create. So this is a real issue. We're minus 122 teachers, and then trying to take care of the teachers who are totally stressed out right now, as well as our parents and teachers, our parents and children. So that's something that I think we definitely have to look at, because I was looking at other sites throughout Florida, and they do have like how many employees and how many students. I know just Broward County, they have 13 students, period. And I know that they're masked. So I think that we definitely need to watch that. And I do appreciate both of you for being here, all of you for being here and sharing your information and keeping us up to date. And Dr. Stovall, I think if you could send that to Ms. Stillwell for us to have the information that you have, I think that will be a benefit for all of us. So I just definitely appreciate you multitasking today and being here with us. And Dr. Savage has a question or a comment.
Just a question. Dr. Stovall, if you don't mind, it's just wanted to ask this question, just the level of hospitalization among the various age groups. So we know that the Delta variant is highly contagious, but just for the board's edification, just for all of us here, what are you seeing in terms of the percentage of, based on the age band, specifically our focus of students in our system between age 0 and 12 or 5 and 12, then again between 12 and 18 in terms of the percentage of requiring hospitalization among that piece? If you would be willing to share any of that data, Dr. Stovall.
I'd have to get that data together for you. Unfortunately, I don't have it broken down like that at the front of my mind, because we'll have to take into consideration all the patients that present to our emergency department. So let me do some work on that, and I should be able to get that information for you.
Oh, thank you, Dr. Stovall. What about via the health department? What are we looking at, any kind of data trends relative to the separation of those different age bands and the level of hospitalization?
For you.
10-4.
Okay, Ms. Gittens?
Yeah, I just, kind of on that same vein, and it's probably Dr. Stovall, the incidence of besides the multi-system inflammatory disease, is there any other long-term effect? Because, I mean, I hear a lot of people saying, well, you get it and you get sick and then you get over it and you come back. And I don't know if they know the real repercussions down the road besides the MSI. Is there any other indication of anything?
So there is some emerging data out looking at long COVID or long COVID. You may have heard that mentioned. We haven't seen a significant proportion of children with those types of symptoms. So we have seen some adults who are having prolonged symptomatology. I would say that at a minimum, we've seen a few older teenagers who have prolonged symptoms. Not symptoms that go away and then come back, but symptoms that take a long time to recover. That's mainly those teenagers who have respiratory symptoms during the acute phase of their illness and not the MIS-C patients. As far as the young kids are concerned, we don't have enough data to look far enough out to know if they're going to have symptoms of long-term effects. Certainly, it's been looked at in previous respiratory viruses like RSV, where there may be some hyperreactivity in the long run. That could happen with COVID, but we're not far enough out from a significant portion of our young children infected to know or be able to predict what that might look like. So I don't think there's really any hard evidence at this point to use for sort of education to the public.
Thank you.
Thank you. Okay, so if I may thank both of you. I know that there were some other questions, but it did not have to pertain to our experts here. Can I thank them and then continue the conversation? Is that, because I know I don't want to keep them from doing what they have to do. So I'm going to thank you very much for being here. We really appreciate it. And thank you for all that you do. Thank you, Dr. Stovall.
Thank you, and I appreciate the care of our patients and our kids.
Thank you.
Thank you so much. I appreciate it.
Thank you. And then I'm going to come back to, because I know you had a question, so Ms. Petrika, so I'm going to come back to your question, so that way we're not keeping our guest.
So I don't know if you can answer this question. You can't answer this question right now, Dr. Savage, through the chair, but what educational options can we provide to our families who are afraid to send their kids to school? I understand that the state is not providing funding for Lee Home Connect, and I am not remotely suggesting Lee Home Connect, because I know that that was a nightmare for our teachers. The hybrid learning is not something that I'm recommending or even bringing up, but I think I mentioned Emergency Lee. Perhaps that could be an online synchronized learning platform available only online, a teacher with only online students. Have we determined whether those ESSER dollars and Secretary, did you say Cardona? I call him Cardova. I'm probably wrong. Secretary Cardona would provide that kind of funding, given the fact that the state of Florida will not provide that kind of funding. Am I making sense? As I look at the vaccination numbers that Ms. Matthews just sent us, we're looking at 44% vaccination rate for kids aged 12 to 19. Is that Lee County information, or is that state of Florida information, the entire state? So we don't know what that is in Lee County, but let's assume it's similar. What education efforts are we making? You know, I would think a football team would be super excited to get vaccinated if they knew that their season was less likely to be interrupted as a result. Beyond masking, what additional steps can we be taking to provide quality education and education surrounding vaccinations and that kind of thing?
Dr. Savage.
Through the chair, yes, I can certainly say, one of the things that we definitely believe in also is our Leave Virtual, of course. Since we closed that portal today, we continue to evaluate those options as well. But I would say, Florida Virtual is another piece. So our Leave Virtual is a franchise of the Florida Virtual School. So they are always another educational option that is available to students as well. If families are concerned about the current spike, we continue to evaluate options and look at those pieces. Plus, we are highly engaged with working with our union to try to come up with the very best possible arrangement that would be acceptable to both our teachers and our staff for their safety, as well as delivering a high-quality educational experience for our students. That continues to be a priority. But our current in-person learning, we not only do have the mask requirement with the exception for the parent opt-out that's pursuant to the executive order. We also do whatever distancing we can do, as well as all of our health mitigation protocols in terms of the cleaning, the encouraging of frequent hand washing, and things along those measures as well. Things that are all on our website. So if anyone wants to review that, if a parent is out there concerned, they can take a look at those pieces. Just want to echo some of the comments that have already been made by our health professionals at specifically the Department of Health. It's so important if children are sick that they stay home. That's very significant, as well as we've stated before, the presence of masks, wearing those masks in conjunction with all those other pieces are valuable as well. So for the in-person learning being something that is very important to a lot of our families right now.
Did anyone else have a question for Dr. Savage at this time?
Not Dr. Savage, actually, maybe Ms. Stillwell. What's the percentage of our students that has opted out? Where are we at with our numbers in that they're not wanting to wear masks? Do we know?
Ms. Stillwell? I think it was almost, what was it?
13,700.
I think it,
I think it's good. I mean, the community needs to know that.
was it 13 or almost 11? I think it was
Last I
11.
saw it was 13,700 or something like that.
The total number of forms that we received as of midnight on Thursday night was 13,441.
I'm sorry, say that again, please.
13,441.
As of
441. This was sent to you on Friday, so this would have been as of 12:01 a.m. Friday.
And that's out of 96, about approximately 96,000 students. Okay.
Yeah, a little less since it's we don't count the charter, I don't believe.
Any other?
Well, I do, actually, for Dr. Savage. So, again, my concern is the 2 to 3 week surge that's fast approaching. I think, other options to do the Home Connect in any shape or form for parents that are just uncomfortable, or if their child is quarantined or sick. I mean, is there a possibility to do, have a couple teachers designated, and it would be more like a chat room, and they would have, ages, elementary and then middle school and then high school, and I'm just trying to think out of the box just to give options for families. It's hard because I understand the mask thing, but I understand also a parent's rights are really important. So parents need to be parents, and that's what's probably the most important thing is if the child's sick, stay home. I had a problem with, honestly, I think the governor's great, but to mandate, no mandate, how is that, how does that work, really? Because, I mean, that's basically what he did. He mandated us to not mandate masks. So, I think that's kind of a little bit double standard, really. So, I just, we want to keep all kids safe, so.
Through the chair, certainly we want to keep kids safe too. I think it is our top priority to have lots of viable options. I think, we obviously believe the in-person learning with all the health safety protocols that we recommended. Or initially, we recommended masks, then we went to the mask requirement. We believe that is, for some of the reasons that were cited on the call with our health medical experts, one of the issues that we did cite was when students are away from and isolated, that can cause an issue, as well as the learning loss. That's a huge educational issue to us. So having students back in school is a wonderful thing for the children. We want to keep them as safe as possible. As you kind of heard from the medical experts, the more masks being worn, the safer the environment, the more of a synergistic effect it has by having more of the masks, according to, not to me, but of course to the medical experts are the ones stating that. So just to kind of restate that is a fine option for parents to utilize. That said, we do have virtual options which give great content. Some students have done that for years, and it's not a new option, but it is an option that's there that some students did quite well in, which with the virtual. So the Lee Virtual is an example of our local franchise, but the Florida Virtual is always available to the families as well. That is out there as well, and that's available for families who don't have that piece. We continue to be flexible and in a dynamic picture of, obviously, we've seen the dramatic increase in the cases, so we continue to look at all options and have those conversations daily. So as new options come available, we certainly would look at that, not to mention not just for our students, but how it impacts our workforce as well. So thank you for highlighting those pieces.
Do you have one more question, Ms.
Yeah, well, and I understand, but when a child's quarantined for 10 to 14 days or so, that's when I'm talking about the home connect. That's the temporary situation, because last year children weren't allowed to make up their homework, being out and turn around and be quarantined again, one right after the other. So, I mean, the communication has to be pretty strong, and teachers have to be very flexible. And that pivot word, that comes back in. So, I mean, that's what I'm talking about is, having an option for when they're quarantined and they're fine, sitting at home, waiting and doing their time. So, just because they were exposed. So, I mean, just because you're exposed doesn't mean you're going to get COVID. I personally had COVID, and my husband never got it, and he should have, trust me. So, it's a very weird virus. So.
Ms. Dupuy-Bruno, did you want to respond to?
Not to respond, but I just wanted to give a few more legal perspectives for the board to consider while you're having this dialogue. One of the things, of course, is that the governor, his executive order is all about parents' rights and the parents' ability to choose their health care decision. This is followed up with the Parents' Bill of Rights, which specifically says that as well, that it is to the parent to choose their health care decisions for their child. A concern, and I want to make sure that the board is aware of it as you're having this discussion, is the Department of Education's rule that also came out on August 6th with regards to what we now call COVID-19 harassment. So if you do have a mandate and you're going to enforce that mandate, caution has to be taken with regards to this new defined term called COVID-19 harassment. In addition, a couple of other things. An executive order, when issued, is considered the law pursuant to Florida Statute 252.36, subsection 1B. That's the governor's emergency powers. The question that is up for debate is whether or not he is exercising those emergency powers at this time, because he has rescinded the emergency. So that's one of the reasons why the rule is being challenged. And the other thing I would like for the board to consider is that at this point, we have two appellate cases that have reviewed and issued rulings on mask mandates. One of them found that a mask mandate was constitutional. Another case found that a mask mandate was not constitutional, both Florida cases. So as you're discussing, please keep that in the back of your mind.
Ms. Gittens? I'm sorry, Dr. Savage, I'll come right back to you. Ms. Gittens?
Okay, and Dr. Savage mentioned Lee Virtual, and I received several phone calls and communication of parents trying to get their children in there, and they were told that they were full. So that is not a viable option. at this point in time. And you want to...
And I just want to clarify, Lee Virtual's our franchise. What I referenced was Florida Virtual School, which is still available to them. It's the statewide model for them to be able to do, but we are a franchise of that. They're
Right.
still eligible to go into the statewide Florida Virtual School. Piece is available to
Okay,
them.
then that's one of our communication faux pas, because parents, when they hear, and I'm not sure they're familiar with the division, and I know last year we talked about it when we had the COVID situation, but we need to make crystal clear that parents understand the two, and also understand the fact that there do I hear you say that there still is availability to get into Lee Virtual?
I'm sorry, through the chair, Florida Virtual. The Lee Virtual did end their enrollment period just due to shortages in terms of their staff as well, not to further inundate their staff, just like many of our schools with staffing shortages. However, that is ongoing discussion. We have to be responsive to the current community numbers, but just to clarify, available as of right now would be Florida Virtual.
Is Florida Virtual, not Lee Virtual? Now,
Right.
in that communication, though, clarifying that with parents, we also need to clarify, and I know we did this last year with the academics department, what is both best suited for what student. Because if parents are left with, okay, I don't want my child to go, the only thing I have is virtual school, and they see virtual school as this one big thing. And then we say, but there's a differentiation academically with Florida Virtual and with Lee Virtual, and we have to make sure they understand that. The other question I had is, I heard rumblings of, people have talked about, well, teachers can still use Google Classroom, and I know some teachers that are home and still using Google Classroom. But the thing that came up is the bargaining issue in that, because if you're sick at home and you're still teaching your class on Google Classroom, it's one thing. If you are home and you're not sick, just on quarantine, and you continue to teach your classes, where is the bargaining issue in that? Because if I'm working, am I not getting paid? And then there's the issue if you get paid when you're out sick. So I don't want to bring that up. I know Attorney Bruno will look at me funny. She's looking over her mask right now. But I'm just saying that's something we need to look at. And my final statement on it, we averaged, 95,000 students is our number that we say. We were only at 80-some thousand so far. A lot of people still from up north feel that after Labor Day, you go back to school. So when we have that influx of the rest of those however many thousand students, it's like Groundhog Day. We're starting over again and having kids and families and bringing in certain things that were not there before. So if we're looking at future, down the road, in my non-medical advice, it's after Labor Day, we're going to have another huge spike. So just saying, thank you.
Thank you. And I think virtual school is virtual school. It's just one belongs to us and one belongs to the state, but it's the same premise as far as they're learning on their own, correct? I mean, because my grandchildren have been in both.
Mm-hmm. Yeah, so the state has their Florida Virtual, and actually they believe they even have like a worldwide campus and whatnot. So it's a pretty broad network. We have our own franchise of the virtual, which is the Lee Virtual. I think the biggest distinction probably for us is that the FTE of students who enroll in Lee Virtual stays with our system. When it goes to the Florida state system, it's a little different. So that's one piece. Also, Madam Chair, if I may, I just wanted to highlight, just to piggyback off of what Attorney Dupuy-Bruno said, I just want to make sure that the specific language for the board as you're hearing and kind of weighing options as to what you might be thinking about in terms of the medical advisement. The governor's executive order, sections 3 and 4, section 3 said that the Florida Commissioner of Education shall pursue all legal means available to ensure school districts adhere to Florida law, including but not limited to withholding state funds from non-compliant school boards, violating any rules or agency action taken pursuant to section 1 above, and that is again the mask mandate, anything that would go against that order. And the section 4 also states, this does not prohibit the Florida legislature from exploring legislation to further protect the fundamental rights of students and parents to be free from excessive, harmful regulation in schools. So those are both additional sections listed in the executive order just for awareness of the board as well.
Thank you. Okay, and I do apologize. I know we're 30 minutes over. Ms. Fisher, if you have one more thing, and then I'm going to ask our next guest to come up, please.
And the only thing I wanted to say was in regards to communication. So I've had multiple parents contact me regarding options. So when we have the Lee Virtual School has stopped taking enrollment, and I think we need to, like Ms. Gittin said, the information for the website and the real-time numbers. I think we may need to make sure that all of our people who are communicating with parents and answering those calls have a clear understanding of exactly what it is that they have as an option. So for instance, I spoke to a parent and said, well, there is always Florida Virtual School. And I was told that no, the people at the, that they talked to said, the only other option I have is homeschooling. So I don't think that we should be having that kind of information being passed on to parents who are having a hard enough time understanding this, getting to work, and keeping their kids involved academically. So I think we really need to make an effort to make sure that our communication gets to all of those people who may be asked a question and have to answer it.
That's good. That's good, Ms. Fisher. Okay, I thank you. So next on our agenda, please, if we could have the elementary proximity plan update part 1. If you all would, I guess everybody's coming up here, joining us. And then when you are seated, if you could please, most of us know who you are, but if you would please just state your name.
Move on, may I?
Sorry?
Before we move on.
Yes. Go ahead, Ms.
So we just had a discussion about mask mandates, but took no action. I want to be clear about what we just didn't do as a board.
Because we're not good at the order right now. So this
Okay,
is just,
all right,
that
all
was
right.
because we were still in a conversation.
All right, well, I have to leave at 4 o'clock, so I can't be here for good of the order. If this continues to go long, just letting my colleagues know.
Good afternoon. Are you ready for us to begin?
Please.
Thank you. So good afternoon, board members, Dr. Savage, Attorney Dupree-Bruno. I'm happy to be here today to bring you an update on one part of Envision 2030. This is our student, elementary proximity student assignment plan, which is one of our big 5 goals. We'll actually be presenting this to you in 2 different sessions. Today is part 1. Part 2 will be on August 30th. So the team that will be presenting today is David Cates from Davis Demographics, Kathy Ebal, who you know, and Adam Malloy, who you know. So today they're going to bring you up to date on the boundary work that has been completed so far. They're going to talk to you about the reasons for this initiative. They're going to give you 2 different map options to consider. And then, excuse me. Excuse me. And then they're going to provide you with their team's recommendation around those 2 options. However, we are not going to ask you for a decision today. During our August 30th presentation, you'll hear more about the policies that are connected to this decision. At that time, we will ask you to decide which of the 2 maps you prefer. We'll also be asking you for direction going forward in terms of specifics around the timeline that you would like to take. But all of that will be at our next presentation. For today's presentation, the actual presentation will be about 30 minutes. If it's possible for you to hold questions until the end, we would appreciate that. We do have 90 minutes total for the presentation, so we believe that will give you plenty of time for for your questions. So with that said, I'll turn it over to Adam Malloy, who is going to start the presentation. Thank you.
Thank you, Board Superintendent. So today we're going to go over the project overview, some of the current zone challenges, the proposed zone alternatives, and then our discussion. We hope to keep it very succinct. It is a large system change as it relates to what we've been currently doing, so we want to make sure that we are being very clear with what we're presenting. Now, this is the purpose of the new proximity plan. This is the one that we have been engaging community members with to offer stronger community-based choices for our students, prioritizing equity, inclusion, and a high-quality education. Our current system is overwhelming. It is extremely inefficient by a number of metrics, and as someone who has spent the last 7 years studying it, it is inefficient across the board. It is disconnected from its original intent and from the history in which it derived, and most importantly, it is not setting up our students and our schools for success. The time is now to fix this system. So in terms of our presentation, I will be presenting some of the goals, outcomes, processes.
I thought he was trying to get your attention.
Thank you. There we go. I got it. Sorry about that. I was changing on my computer. So in terms of the proximity zone update, that didn't take away any of the the time is now part. Okay, well, we'll go back. We can.
You're good.
Yes. I will be covering the goal, outcomes, the processes, the history, and then Ms. Ebal will be covering the current zone challenges, location, diversity, bus routing, and community growth. And then Mr. David Cates from Davis Demographics will be doing the proposed zone alternatives. Just a big thank you to Davis Demographics. His flight was canceled a number of times, stayed in Texas last night, barely made it into Fort Myers. I ran and picked him up, I think at 11:30. We got him changed very quickly, and so he is here with us today. So these are our project outcomes for the proximity plan for our team. A better system for our community and future, reestablishing a stronger connection between our parents and schools, strengthening the diversity at the elementary school level, and then reinvesting those funds from transportation back to our school sites. This is done strategically through the latest GIS technology, reestablishing connection between our communities, our neighborhoods and their schools, going from, if you live in South Subzone 1, from 12 choices, or in East Subzone 2, 17 choices, to on average about 4 choices. Part 2, on August 30th, in 2 weeks, will assist us with the strengthening of diversity at the elementary school level and what are some options for us as a district moving forward, and then funds estimated in the millions to reinvest at our school sites. In terms of the process, we have been at work for about a year and a half on this project, meeting bi-weekly with different members of the proximity technical working group, our extended community members, our public meetings that we did in January, and then our over 60 project-specific presentations out there in the community to receive feedback. You can see that in January, we started sharing those initial scenarios, and then we use the feedback to make modifications to each one of the plans. In fact, our email address, the proximity plan at leeschools.net, we would take whatever community feedback that we had and we would bring that to the meeting and then see how it worked in terms of the changes. And the public was actually very great about pointing out some things that we needed to fix and that we needed to address. Also along with the process, I wanted to just make sure that you guys were aware too that the district and our team really focused on the policy side in that May to June time period as well, to make sure that we had the policy companions to go with these new proposed maps. Just a little background on the history. I know it's a little bit boring. A little bit boring in terms of the overall kind of like, table or formula here, but the bottom line is that our current student assignment plan has its origins in the district attempting to gain unitary status, so to be removed from the federal court order that was started in the Blaylock case. Okay, and I think that is extremely important to note that the choice system that we currently have was designed to get us out of the federal court order with very specific goals as it relates to the distribution of students that are currently on pages 18 to 23 in the plan for student enrollment. That includes goals and ranges acceptable for race, ethnicity, English language learners, and FSA. And that is the part that I think in 2 weeks that we'll really get to address there. But we have become untethered and disconnected from this history. We have allowed this choice system to run rampant, and it is completely disconnected from its original intent, which was to gain unitary status in the late 1990s. So unitary status was gained in 1999. A 5-year supervisory period followed, and then race was eliminated as a criterion in 2005. The past 15 years, we have operated our large 3 geographic choice zones, with each of those choice zones, west, south, and east, being divided into subzones. You currently choose a school in the subzone that you live in any adjacent subzones. So if you live in subzone 2 in any one of the zones, you are ranking schools 1, 2, and 3. So the most that we have is in East Subzone 2. You are currently ranking 17. All right, and you have the opportunity to go to each of the 17 and be transported there. So I'm going to turn it over to Ms. Ebal to talk about some of our current zone challenges.
I'll let you keep that away. Fantastic. So in terms of our current zone challenges, we want to look at, and we've been looking at, what is broken with our system. Adam very eloquently described a system that today isn't functioning the way that 20 years ago it was designed to function. And that doesn't mean that 20 years ago they designed a bad system. It means that 20 years is a long period of time, and we're going to talk about that. And communities grow and change in 20 years. So what worked 20 years ago isn't working today, but that it shouldn't be expected to be working today. Zoning systems like this, which are dependent on student growth, dependent on location of schools, depending on systems of where people are choosing to live, it should be evaluated at least every 5 to 10 years. We're 20 years, so that this system has lasted this long and been as effective as it has been actually indicates that 20 years ago they did a good job of developing it. But today is not the same place. We are in a different community, and we need to relook at our systems, as we should do on a regular basis. So we're going to start with an evaluation of where we are today. As Adam mentioned, the zone that has the most number of options is East Zone 2 with 17. The 3 subzones that have the most choices are East 2, South 2, and West 2. Excluding the barrier islands, which have 1 choice each, the fewest zones are in South 3 and West 1. All of the other options have at least 11 choices. That's 11 places that the parents can choose within that subzone. That isn't including the adjacent zones that they can also expand into, all of with busing options. When you look at the size of these zones, they're also very large. 3 of our zones have more than 100 square miles. South Zone 3 is 139 square miles, East Zone 2 is 129 square miles, and East Zone 3 is 120 square miles. When we look at the size of our current subzones, our 3 largest zones are East 2, South 1, and West 2, and that's in terms of student enrollment. All of the subzones we have, except for the barrier islands, have more than 1,500 students. Given that our elementary schools have between 500 and 1,000 on average students, this is a considerable number of students who live within our subzones. When we look at the choices, again, when we look at the elementary school sites, where our schools are we select schools and land
based on land, not based on necessarily need of students. That has created a disproportionate areas where some schools are very, very closely located, close within each other, and some areas don't have any schools at all and are having to transport their students quite a bit of distance. So it's not necessarily tied to community growth or neighborhood development as it is where can we find a piece of property. For example, in the East Zone, Lehigh Elementary, G. Weaver Hips, Veterans Park, and the future Elementary J are all located within 2-mile radius of each other. The farthest distance within these 4 schools is from G. Weaver Hips to the future Elementary J, and it's about 5 miles. In the west, Skyline and Patriot are a third of a mile from each other. And there's additional schools that are within that 5 to 7 mile radius. So again, we have areas, pockets of areas in the east and the west where schools are very closely located to each other, but that means that there's areas in both of those communities that don't have schools. In the Cape, the northwest quadrant of the community has no elementary schools located in its area. In Lehigh, the southeast portion and the southwest portion don't have schools that are immediately located within their neighborhoods. This leads to our current solution, busing. We have a high number of bus routes, among the largest in the entire state of Florida. This provides increased demands on transportation. As parents who may not want their children to be on a long bus ride, which we're going to talk in just a second, decide rather to drive their students to school. I was just speaking recently to a parent who is waking up in the morning to drive her child to high school, to school by 6:30 in the morning, then goes back to take care of her elementary school student, then gets to work because of trying to make sure that everyone is watched and cared for in the busing situation. And this is because of the disparity of where our schools are located within our neighborhoods. If you had neighborhood or more community-based schools, you could ask your neighbor to take your child to school. You depend on your social network to ensure that your student is going. But when your student is going to school at a school that's across town, that breaks up that social fabric that we need to have in order to allow for that integration and connection between our schools and our communities. So transportation becomes a major challenge for us. And it's not just in the cost. While the cost is very high, among the highest in the state of Florida, with an estimate of a total expenditure of about $7,000 per route. The average number of stops on each one of our routes is 15. The most number of stops on any one of our routes is 25. The average time a student is spending in a bus one way to school is an hour. People talk about long commutes and how can you spend an hour in a commute. Our students do it every day. The longest bus time is over 2 hours, 143 minutes, one way on a bus. That means that they're spending over 4 hours a day in a bus.
That's crazy.
But the bus route timing isn't only about the amount of time that our students are spending and the number of stops. It creates a demand on our service in terms of cost, time, and human resources. We currently have a shortage of bus drivers. The high number of routes that we have contributes to our problem. If we were able to have a reduced number of routes, we wouldn't need as many bus drivers, and therefore the shortage, which, to be fair, even other school districts are facing shortages of bus drivers who have different types of systems, would not be as great. It also has a problem with bus discipline. We have a large number of disciplinary actions because of students and they're on the buses. And when you look at the amount of time that children are spending on buses, you can see there is some correlation there. So let's break that down further. What does this really mean to a local neighborhood? We're going to give you 2 examples. One is the Vizcaya area of Cape Coral. In the Vizcaya area of Cape Coral, 5 schools transport their children to and from, through and from this area to a school that is 6 miles or more from their neighborhood. One is 7.5 miles away. 4 of their schools, 4 of the schools that are being taken from this area have less than 10 students. All but one has more than 26. So you can see there's a large number of students who are going from one area and they're being distributed throughout Cape Coral, and they're spending a lot of time going from one place to many different places. Again, tying back to that social network that we talked about, it's hard to call up your neighbor and say, can you take my son to school or pick them up from school this afternoon, when your neighbor may not go to that same school. So you really are eating away at that community network that is so important to schools and communities. The next example we want to give you is south of Lee Boulevard. This area has 625 students who live within this red box. They attend 21 different elementary schools, and they're transported by 15 different buses. 10 of those schools are more than 9 miles away. One of the schools is 17 miles away, and one is 13 miles away. So now we want to break it down. We want to look at it from a different perspective. We just looked at it from the school, where neighborhoods are going. Now we want to look at it from the school perspective. The Gulf Elementary School, the K-5 distribution, they come from as far away as 13 miles. There are 285 of those students who attend from the adjacent zone, West Zone 2. So going back to our earlier conversation about the number of students within their zones, this is looking at not only their zone, but the adjacencies. The West Zone 3 families can choose up to 11 schools. And again, this is all part of that community disconnect. Each one of those dots that you can see, and I understand on this map it's kind of, at this distance it's hard to see because of the yellow, but each one of these dots represents a student. So you can see that students to Gulf Elementary are coming as far away from Burnt Store in the northern area, again, where there is no elementary school up in that area, so they're going to have to be transported to somewhere. And then they're throughout the community, even into East Fort Myers and Bayshore. The next school we want to look at is James Stevens Academy. At this school, students are coming from as far away as 14 or more miles away. There are 186 students who attend East Zone 2. Again, it's an adjacent zone, not their zone. And families from James Stevens who live within East Zone 1 alone can choose from 12 different schools. Again, we have a high distribution. When you look at the dots, you've got students from East Lehigh, you have students in Cape Coral, and you even have students in South Fort Myers. They're coming from a very large distribution of area. And finally, we want to look at a school from the South Zone, which is Heights Elementary. Heights has students who come from as far as 13 miles away. There are 189 K-5 students who are in the adjacent zone, South Zone 2. And students within their zone can choose from up to 12 schools. That's just their zone, not the adjacent zones. Again, the map is showing you a wide distribution from as far away as Cape Coral, Bayshore again, and then South Fort Myers. So what is does this mean in terms of community growth? I talked to you earlier about, we aren't saying that this plan was a bad plan 20 years ago. It probably was a very good plan 20 years ago. What we're saying is, we as a community in Lee County have changed. So I want to share a series of maps that shows you, based on our current population, our most recent census data, what that change means. First thing I want to say is these series of maps all rely on a series of dots, but the dots aren't proportional to each map. They're proportional only to the map. So if you look at a large dot in one spot and then you look at that same dot in another map, it's not proportional to each other. It's proportional to the data within that existing map. So in terms of community growth as a whole, what I want to say to you is Lee County is not growing proportionally at all age levels. There's a 6-to-1 ratio of over 65 population and under 18 population. It means that 6 times as much growth is happening at the over 65 level than there is at the under 18 level. That's significant for us as a school district because people will say, especially in certain parts of the community, as we're going to talk about in a second, that area is growing. And it is. That it may not be growing with kids. And that's something we really have to be mindful of as we talk about growth at the county level, because yes, the county and all of their public services has to take care of everybody. We need to really focus on that 18 and under population. That's where we're driving our students. So the next one. Oh, I'm sorry. The dots got me confused.
Yeah, so there's the net population. Oh. Do you want net population or 18 under?
Yeah, I want 18 under. So when we look at the 18 under population, our total growth from 2010 to 2021 was about 14,000 students. There are 14,000 people. This is 18 and under, so this does include some who are yet to be of the student population. But when we break that down by our zones, it's a very different story. In the West Zone, we only had a growth of 660 kids. There are 660 people of 18 and under. When we look in the East Zone, we had a growth of about 6,000. And when we look at the South Zone, we had a growth of about 77,000, 7,100. You break that down even further, West Zone 4 actually lost people of this population. They lost 160 population and the 18 and under. However, in East Zone 1 and in South Zone 3, you had a growth of about 4,000, 3,500 in South Zone 3 and 4,000 in East Zone 2. So again, even within the zones, it's not proportional. Although as an overall, we have seen growth, but growth in specific communities. Now there's 65. Now when we look at this at a 65 and over population, first of all, there's been a much greater growth in the 65 and older. We have had 80,000 growth of 80,000 residents in 65 and older. Again, that's correlation to a growth of about 14,000 from the 18 and under. In differences from one zone to the next, the greatest difference was in the West Zone. There was a growth of 24,800, 65 and older to the 18 and under. In the South Zone, there was a growth of 31,000, and in the East Zone is 10,000. So the greatest difference was at the South, followed by the West and the East. When you look at the top zones for growth at the 65 and older range, the West Zone 3 was the third lowest. Well, the top three were West Zone 3, 10,000, South Zone 1 had the most in the South Zone at 14,000, and then they also had South Zone 3 had another 14,000. The greatest in the East was in East Zone 2 with also 10,000. So those four were your top: South Zone 1, South Zone 3, West Zone 3, and East Zone 2. When we look at expected growth as we move forward, our total expected growth in the next 10 years is going to be about 10,000 students, 9,571. The three greatest zones are expected to be South Zone 1, East Zone 2, and West Zone 3. South Zone 1 is expected to grow by about 3,200. East Zone is about 3,400, and West Zone is about 3,000. So now that you've heard the challenges when it comes to transportation and your demographics, I want to have I was about to say Dominic.
Almost Dominic.
I want to have
He was
Adam.
a former team member.
Yes. I want to have Adam talk to you about what the challenges are in the diversity section.
So just to draw your attention here, these are the current FSA distributions by score level and subzone, and then also ethnicity. And this is current. Now, don't get lost in the colors in the distribution. All of this looks fine, right? The problem is that it is completely masking what is happening at our schools. They are not being evenly distributed among the schools in those subzones, right? That is a disconnect from the plan's intent. Again, pages 18 to 23. There doesn't have to be a rewrite. You just have to enforce what we have here. And, you know, if you look at the large pool, we have currently about 29 intensely or at-risk segregated elementary schools, right, and middle schools. We have 8 that would be classified as intensely segregated and 1 that is approaching the apartheid school designation of 99% non-white. That is, again, disconnected from the origins, the history, the plan. Now, this is not just about race and ethnicity, because there are plenty of other diversity criteria that we want to promote in our schools. The FSA distribution, scores distribution by school level. We have, let's just, for example, you have a school A, that last year had about 60% of its third graders proficient in the FSA. Less than 2 miles away, you have school B, which had 17%, right? And in our current plan, we talk about what high concentrations do to the teachers, to the staff. If you think about accountability, how are we setting this up? So when you look at these large subzones, the diversity is there from FSA, ELL, race, ethnicity, right? But it's masking what is actually happening in the system. And I'm sure that you guys, it was visible to you last week when I think we saw, since August 1st, about 2,000 people register, right? The line was wrapped around, right? They're not getting the same choices that everybody is getting, right? They're getting what people on average ranked 11, 12, 13, 14, 15, 16, right? That's a system, those are some efficiencies that need to be corrected.
So I just want to quickly mention from Adam, and Dr. Savage was part of our team and helped us a lot as we looked through this data, and we're data junkies. So when we were looking at all this data that we just gave to you, we could spend hours looking at this and understanding what this means. And what it means in a nutshell is this. The plan as it was developed 20 years ago could have worked if parents had made choices that allowed for the diversity to happen. But what Adam just highlighted is it isn't working. That even though the parents have the choices, even though there's the ability for the policy to work, in the end, it's not. And that's why, so all the stuff that I talked about wouldn't matter if in the end what Adam brought to you says, even though there's transportation inefficiencies, even though students have a lot of choices, even though the buses are making multiple stops, even though all of that, if in the end the diversity was working, then we would call this plan a success and we would say we're good. But that's not where we are. Where we are is we have all sorts of challenges from an operational standpoint, which is what I highlighted, and yet we're still having problems from a diversity standpoint, which is what Adam's highlighting. And now we would like to turn it over to David Cates, who's been leading our effort, to show what we think might be some solutions as we try and address both the operational and the diversity challenges that we're facing as a district.
And David, too, before he gets going, there will be some continuity to some of those case studies that we saw so that you could see the current what's happening and then what would be solved in the proposed.
Well, good afternoon. Thank you for allowing me to be here today. Before we get into the maps, I want to just say a few things about what's been going on now for a year and a half. It's hard to believe it's been that long. Essentially, it was a very collaborative effort. We worked with not only obviously key district staff, but we had community stakeholders, we had district stakeholders, we had inner working groups that we work with. I don't know how many meetings we've had, probably 60, 70 meetings over, maybe more, over the last year and a half. So it was a very collaborative effort, and I think all of you were there in January. We took these to the public. We had public input, both in person and through the website, and that was rolling in for months. We took that into account. So when I use the word we, I might say we, it's not just the three of us, it's all the people that were involved, including, like I said, many community members as well. So I want to make that clear. The other point I want to point out is that the criteria that we mostly used initially for these plans is we looked at obviously you saw those dots, we know where all the students live. So we want to know that we are as best balancing these future zones. So we looked at where the students lived in relation to the neighboring or nearby schools, clustering them, and looking at the capacities for those schools, so that not only in the next 5 years, we want this plan to work for at least another 10. But our forecast that we roll out usually is a 10-year forecast. So that was kind of our end period there. And we just want to make sure that we are not setting the system up for failure. We want to make sure that if you adopt these plans, there's plenty of capacity for those schools to house those students for the next 5-10 years as well. And also is helping the district site where future schools might be as well. And also, I don't know if it was mentioned before, but there was a packet of data and maps that we sent to the board last week that has a lot more detail if you wanted to zoom in and literally see where the boundaries are, because on the maps, they're going to look kind of, washed out a little bit. We have other socioeconomic data in there as well, so feel free, if you haven't done so already, to look through that data at your leisure as well. So what happened was that we had originally, this is going back to last year, 3 maps that we'd worked with the stakeholders, and then after having some in-depth meetings with the public and the district stakeholders late last year, we developed a 4th map that was really kind of evolved, and we really put a little more thoughtfulness into taking the public's input as well as just looking at some of the data and some of the transportation limitations on some of the routes as well. So we narrowed it down to, we had 4 we presented to the public in January, you were there. And then after all months of public feedback, we made alterations to the maps, which I'll go over in a moment, and we narrowed it down now to 2 of the most popular, I should say, of the maps, and we'll tell you what our recommendation here is in a little bit. So you'll see there's map 1, and that's why it says map 4. So these were based on the feedback, again, from the public and committee members as well. So let's start off by telling you the similarities of these maps right off the bat. So the highlighted areas in color, we did all these by letters. So you'll see letters from A through, I think, T in here. That's the way we decided to do it. So the Cape Coral area, that's A, B, F, and G. Those are exactly the same in both scenarios. The North Fort Myers area, the same. And then also the area Q, which encompasses from San Carlos down to Bonita Springs. That's all one big area. That's exactly the same. And we're not proposing any changes in the island areas. We might have given them letters, which are new to you, but we are not proposing any changes for the island. So I want to get that out of the way so you know those are the similarities in the maps. And in a little bit, I'll show you and zoom in on the differences. So let's start with map 1. these are the overall statistics. I'm not going to necessarily go through each one, but you can kind of see after what Kathy shared with you, you could see just scrolling down the square mileage list. You have one very large area, which is Area Q, and we debated this as a very debated area. We decided to keep those areas intact for diversity and other reasons as well. So it's a very large area, but all the rest of them you could see are much more manageable. What I'm calling, again, these maybe more of a community zone. And that's kind of the way these are called proximity areas, but we're also trying to give this a community appeal. So you can look at these, like I said, as more of a community zone. And you can see the choices, because the concept is that within each of these zones is a certain number of schools, and they would have these choices of these schools to go to, or at least to have the school transport them to these schools. So you have, and the ones that are below that are the island schools. Again, those aren't changing. And then there's potential sites down there, down the line, that we know where the growth is happening, that, there's just some choices of some schools that the district has not decided exactly where they're going to be or when, but this process has really helped the district kind of organize how they're and when they're going to implement the opening of new schools. So that's our basic numbers for map 1.
Before you move, may I ask a quick question just to clarify what I'm looking at? Originally, when you took it to the public, that number 4, I thought was that the one that everybody was saying, yeah, this looks the best or whatever, with the exception of cutting out San Carlos from the South Zone. Am I correct?
Well, like as I mentioned, if you see on here, Area Q, which I'm referring to, includes from San Carlos all the way down to Bonita Springs.
Right, but what I'm just clarifying, previously,
Yes.
San Carlos was not a part.
Actually, you're right. You have a good memory. I'm sorry.
Okay.
Yeah,
That's all
this
I
is an
just
example of the alterations we made to the maps
Okay.
after public input.
Okay.
So yes, you're right. We did have some scenarios where that Bonita Springs kind of was its own isolated area.
Yeah.
So again, because of all that, we just decided to make this one big area, and it kind of really does work out well still.
And the other thing that the large zones allow, the largest zones that we've created, A, Q, D, and M, we identified for future where we would put new schools, and if we had new schools in those zones, where we would be able to make divisions in those areas, so that this map could be easily altered in the future without having go through a whole rezoning process, but could identify those areas on the fringes, which are the larger segments, and as those communities grow, as they inevitably will, that we could make divisions in them.
Yeah, we look at this process as an evolving process that, as Kathy mentioned, typically school districts reevaluate, if not every 5 years, at least every 10. So we wanted, even though we were focusing on 10 years, we did want to think a little bit beyond, even though who really knows, beyond 5, let alone 10. We tried to be very conscious of that. My next slide here, this just breaks down the number of students in each of these zones. Again, you could always flip back to what your current ones are. We try to get these down to more in the 2,000 to 3,000 student range, as you can see. And then we have the projected counts 10 years later. And then the last column on these show you what the current capacity grouping is, and then potentially down the line, when future schools open, what the capacities will be. We're not exactly saying when and where they're going to be, but we know generally they fall within these certain zones. So when you want to look at your current situation, you can flip back to these maps to see apples to apples, kind of how they'll break down. But you can see we've consciously tried to really get a more uniform number of students in these areas, rather than you seeing those really large numbers you see in your current subzones. So there's that. And for map 1, again, these are going to be a little more general statements on both these maps, but just so you understand as well. Areas L and M, which are kind of the bluish colors that make up a lot of it, is the Lehigh area. That L and M are going to essentially start out as one area, because right now there's only 4 schools between those 2 areas. But as Kathy mentioned, as new schools evolve and maybe get built in area M, let's say, then M, we've drawn a boundary where maybe that will branch off on its own with its own 3 schools, but not right away. So keep that in mind. And Kathy also has mentioned those larger areas like A, which is in West Cape Coral, or Cape Coral area, D in the northern part of the district, and Q at the bottom. They're large, but maybe 10 years out, eventually these might split up into smaller areas once you get those future schools we're not sure about built. So there's always flexibility in there. And just to circle back to our case studies that Kathy shared with you earlier, if you look at area F, which you can kind of see a little bit in the gray area on the left, that's the Cape Coral area, the southern part of it. Gulf Elementary had three choices in this plan. They had 11 currently in the zones. In this plan, James Stevens falls in area I, and then that has currently 12 choices, but this plan would have 6 choices. Okay, and then area O is the Heights Elementary, and that has right now 12 choices. That would go to more 2 to 3 in the current plan on map 1, just to give you a perspective there. And then lastly, to kind of walk you through the construction of this particular map 1, I'm going to start with Fort Myers and then kind of go clockwise. So as I say in my notes here, Fort Myers essentially has been broken up into 2 zones, which we call H and I. Each of them have a choice of 6 schools. Okay. Area D, in this scenario, bounded by I-75 in the west, has 3 choices. And then you get into the Lehigh Acres area. Area K is a nice compact area, has 3 school choices. I told you about L and M. If you combine them, there's 4 schools, but there potentially could be more in M, so that could be 2 zones down the line. Area J on this map, map 1, is a little more compact, or a little bit smaller. It has currently 2 schools, and there's plans to build a K-8 innovation school within that boundary as well. And then area O, down south of Fort Myers, it currently contains 2 schools, but there could be an expansion of a 3rd school, so give it a 3rd choice. And then we have the numbers here to kind of, or just graphs to show you the numbers. So we put the current boundary information on the left, and then the map 1 numbers here. So this is your FSA, your test scores, which we used as one of our criteria. We still group them by the east, south, west grouping, so you can kind of get a geographic area, but you can kind of see we try to do our best to keep similarities between them. It's really hard to do once you go a little smaller, but they still do reflect the appropriate areas that they came from as well. The island areas, again, they are kind of off by themselves on the side. We're reporting them there. And there are some similarities between some of these areas and test scores, but this does kind of give you a perspective. You're going from 12 zones to, I think we have in some of these scenarios like 18 or 19 zones in these 2 maps. And then on the other, we also have the ethnicity breakdown, also by your current boundaries on the left versus what map 1 is proposing. And you can see the trends. There's a lot of similarity in the trends, but you can see how they break down on the different criteria there. Cape Coral is, very similar areas in each of those zones, but this is more for you to kind of take in at your leisure to look at those numbers as well. And we have the numbers in that packet to back it up if you really want to see the detailed numbers as well. So let's take a look at map 4. This is the other one we're presenting to you today. This plan, as you can see up there with the numbers, again, very similar to the other map, is that the areas are uniformly small, except for one of the major differences is area H. This is essentially the heart of Fort Myers. This one is still over 100 square mile area. In this particular map, they would have a choice of 5 schools in that, 8 schools, looked at the wrong line there. D is the one that had the large area up there. I was looking at the wrong number. Q is still the same size, that large one down at the bottom. But in this plan, like I said, we have a large Fort Myers area, but other than that, most of the choices are 3, 4, and in one case 5 school choices in each of these areas, except for the island schools. And then again, this is our breakdown of our resident counts, more or less currently in these zones, what's projected 10 years later. You could see, again, the one that really stands out is that area H. It's a much larger zone. This was brought up by the stakeholders. They kind of like this idea Because if you look, think of H, which is again the majority or a good chunk of Fort Myers. Right now, that area is in South Zone 1. That has, again, I forgot how many, 11 schools in it, I think. 12. It's 12 even?
It's a lot.
It's got covers a wide area. This is a more compact boundary. Even though it's a lot of schools and a lot of children, it's still, actually, you have the capacity there. You can see it in the numbers. It's got the capacity for that growth that we were showing you. So you've got room in those schools, and you've got some expansions going on now. So this is just another way of looking at how you could address the Fort Myers area. But we got this from a lot of feedback from the stakeholders and from the public. So that's one of the major differences there. And some of these comments are the same, so I'm not going to really say them over again, but it's a little bit more zoomed in look of what your boundaries are in relation to your current subzones. You'll see that kind of red and white dashed line. I didn't say that before, but those are your current boundaries. So you can kind of see how they overlay with these. The other thing I want to point out in this one, again, we didn't change the Gulf area in this plan, so that you still have 3 choices now, which had 11. But one of the differences, James Stevens actually falls in this plan in area H. So in your current system, they have 12 choices. In this plan, they have 8 choices, okay? And then O, which in this plan expands a little bit more northward, if you notice, grabs part of the southern part of Fort Myers. You add more choices. So in this, it's a larger area. So whereas now the Heights has 12 choices, in this plan, you'd have about 4 or 5 choices in that area. And just a quick walkthrough of the differences. I already kind of pointed this out to you in this plan, is that area H, like I said, that's the main big difference. So we don't have that H and I split of 6 schools each. This is 8 for a larger but more compact. And that's important to think about for bus rides too. If you literally think about getting through, I know it's probably heavily traveled, but still they're not having to go all the way down or all the way up. It's a more concise area. So this does still work for the transportation work as well. That area D expands a little bit more to the west. So there's a couple of schools that takes from very northern part of Fort Myers. So you have 5 schools in area D in this choice. And if you look, the K and the L, they expand a little bit more northward. They still have the same number of schools choices, 3 or 4 in there. We just were looking more at transportation issues, especially in the Lehigh area with I guess I'm calling them canals, or where you get kind of stopped. We looked a little bit more carefully on how the transportation would work. We also gave up a good chunk of the heavily dense area in Lehigh into area J. So J is, if you notice between the 2 maps, J is much larger or wider in this one. So this still has the 2 existing schools and the innovation school, but potentially probably another couple of schools would shift maybe from the M to the J. So this is that thing we're talking about. We know more or less where schools are needed. In this plan, J is a much larger area, but it's an area of growth for future schools as well. And then, as I mentioned, O, it moves a little bit more to the north, so you have a little more choices in O as well. And just like with map 1, we have your current boundaries with the test scores shared to the right with what they are in the breakdown in map 4. And there's still a lot of similarities in there. It's not too far off. And that also deals a little bit with what Adam mentioned about some of the variances. They really weren't that far off. And then the last one with the ethnicity on map 4, same thing. Current boundaries, current subzones versus what map 4 is. So you could flip back and forth or look at the underlying numbers with the packet that we put together. So I guess we're going to pass it back to Kathy for a moment, wrap it up with some transportation information.
So we talked a lot about transportation before and the current situation with our current zones. This proposed map, and this is looking at map 4, does make improvements. We go from an average of 61 minutes to an average of 45. Our average on the distance of the route is 22. It goes to just about 18. But where we're really significantly making improvements is the number of routes. We go from 525 to 444, which, and this is a conservative estimate of estimated savings on an annual basis is about $5.5 million.
So in terms of the community feedback, David, if you just want to go to the next one, I think we could be good there. Sure. Yep, thank you. You know, and I know that this is going to require another tour to community engagement, tour de force, in terms of getting the message out there. Anytime you're changing a system that's been entrenched for 15 to 20 years, you want to make sure that stakeholders across the board are engaged. You know, we got feedback, a team, and we processed it. And I think that that was one of the things that I was most proud of, was the way in which all of the voices were heard by the technical working group, whether it was a comment that was made at a public meeting or the over 200 emails or public input forms in which they ranked the plans and provided feedback. A lot of the cleaning up and why you see the similarities from maps 1 and 4 is because those concerns were addressed. And I think when we go back out there, I think the community will appreciate how their voices were heard. And, you know, the project-specific presentations, you know, we tried to get all of the chambers, rotaries, realtor associations, board advisory committees, which were extremely supportive, the access to the MAPS website and web app, which we've taken down just because we're cleaning up and we're checking where we are now. But we're going to provide back, because we've had requests from the public, well, where are you on this? You know, you had told us 2022, 2023 is implementation. So people, you know, the community is very connected with this plan. And yeah, we do understand that, you know, that this is going to require another round of very serious engagement and working together as a district leadership team with you guys going out there. But I think that that's, you know, I think that that's something that has to be done. In terms of a recommendation from our team, we do recommend Plan 4 moving forward for your consideration. And that's, you know, that's not just because it is the cleanest or that it required the most work, but because it is the product of the collective community. And that was something that we really wanted to show you guys, that Map 4 did take a lot of the concerns. And you saw how each one of those new zones were broken down by FSA and by ethnicity. You know, the critique here is that, oh, you're going smaller, you're going to neighborhood, you're resegregating, right? But we have the ability in these new zones, if distributed properly, right, to get what we want, and that's to set these schools up for success by a more even distribution of students. The answer to the resegregation question is we already have. Now, what are we going to do? So I think that that's extremely important for, you know, for us to know, and the data is there to support it. But thank you again, you know, for your time.
And on that, we open it up for questions. I'm sure this is a lot of information to absorb, but we look forward to.
Okay, well, where is Bayshore at on this? Does Bayshore stay in North Fort Myers, or does it jump over the?
No, it stays in, it's in D in North Fort Myers.
I couldn't see that, okay. And then H, I know with H, because I know that area very well, because that's my area.
Might be C.
That does become a minority area. And I know it's going to be more walkable because it's like old Fort Myers, so it's inundated with homes. And I know that all the rebuild that they're building, all those thousands of new condos will probably be the people without children for sure. But that does create that in there, in that whole area, which is something that you're saying that we're trying not to do. But all the people that will be walking will be primarily minorities, because they'll be in that cluster of, so what is it? Edison Park, Allen Park, Orangewood, James Stevens, Villas is probably, I can't tell if that's in there or out of there now.
Yeah, so in Zone H, the one that you're referencing in Plan 4 has Edgewood, James Stevens, Franklin, Edison, Allen, Orangewood, Tanglewood, Colonial, and Ravy Pottorff.
Okay, look at the schools the way they are right now, and then look at that. I'm just, for future. I'm going to go to Ms. Vaughn, and then
Bayshore is in C.
I'm sorry?
Bayshore is in C.
Thank you. Ms. Vaughn, and then Ms. Patrica.
As students transition from 5th grade into middle school, I think what we would like to see, at least we've touched on this, are some feeder schools, that some of the elementaries, because that gives for better planning, between the feeder schools and the middle schools. I know that this is focused on elementary schools, but how does this shape up in terms of placement of middle schools looking ahead to when those students leave 5th grade and go to middle school? Are we going to be in good shape, or are we going to have to go back to square one?
Ms. Vaughn, we are still in the process of evaluating those connections, but we certainly can do that sort of an assessment and get it back to you in the next few weeks.
Okay,
we were really focused on the elementary level.
Well, no, I realize that, but when you look at a school district, you have to look at the whole thing. And what we want to see is from pre-K through 12, that we have some kind of a continuous system, a system that builds on each other. And so what I'm really asking is, okay, let's say there's 15 elementary schools or in a certain area. Are there like 3 middle schools that they could focus in, or are there some areas where there might be 15 elementaries but only 1 or 2 middles, and then vice versa? I think that's really an important consideration, and I would like to see that data.
Sorry.
Dr. Savage, I think, has something to...
Yes, I'm more than happy to address. And so one of the concepts that we discussed as part of the organizational concept was an area superintendent concept. So actually this foundational level, because you're precisely right that you certainly don't want to just go through an elementary boundary study without also looking at the consequent impact on middle school and high school, as well as choice and feeder patterns to that extent. So one of the things we did throughout that time period, and I was involved in this as well, is consider potential implications on middle schools and high schools. So one of the examples that I brought forward that I mentioned about the area superintendents is that conceivably if we went to 4 zones, so what we currently have are 3 zones and numerous subzones within, if we were to instead transition to, say, 4 regions using an amalgam of these particular smaller choice zones, you could theoretically have about 20 schools under the supervision of each area superintendent. It would be on average about 10 or 11 elementary schools, 4 to 5 middle schools, and 4 high schools in each of those regional concepts. So while that is not on for discussion today, but it is certainly one of the considerations that we could bring forward at a future time, and to ensure that the appropriate level of capacity was present in each of those pieces, which was a part of that study as far back as November. So some of the work that we talked about, the reorg, was actually aligned with that very question that you talked about as well.
And actually, my second question was just with that, because I was going to say, are we married to 3 zones? And when I thought of that particular question, I was thinking about what Dr. Savage had presented. Of course, that's way down the road. It's nothing that we have even put our stamp of approval on as a board, or maybe we wouldn't. But honestly, I think whether we stay with the 3 iconic zones or we do a different division, even as we are focused on these elementary schools, we would be very short-sighted not to look at the placement of middle schools and then, of course, high schools. And then, it may well be in the future that some of the schools, like maybe, I'll pick on Cypress Lake, big magnet school with the arts, and oh no, here's another one that wants, that we have to be sure that each sending area has the comprehensive high school, an arts high school, and the various, so looking to the future, even though we're focused on the elementary schools, I don't know how we can do an adequate job of this unless we already start thinking about where are those schools going to feed into.
I want to build off of what Dr. Savage just said, and to assure you as well. When our company, we did the forecasting and helped you with the boundaries, we didn't just forecast, even though it looks like we did, only K-5, we forecasted K-12, even going out 12 years. So periodically with Dr. Savage, he would come in every so often and bring up some suggestions, and one of them was, let's see how these group together and feed into the middle schools, even though we're not changing the boundaries, and we wanted to make sure that the numbers work. In a lot of cases they did, but that also led to some other creative ideas that maybe might come on down the line before you at some point, because you're right. Because you also have a hybrid of elementary and K-8s as well. And so these boundaries affect those a little differently as well. So we didn't ignore them. That wasn't our task, because that's another plan for another day. If you want to go down that route to adjust your middle and your high schools to have direct feeders, that can be done. But we did kind of look at that, but we just didn't use that as a major criteria in forming these areas. Typically, these boundaries are evolved from the ground up. So you start at the elementary, because these are smaller zones, if you will. In the middle, if you, like you mentioned, you take away your 3-zone concept and you refocus, maybe it's on a 4-region thing. You can group certain ones of these areas, see how they feed into the middle and then the high schools, and you get actually a more direct flow, even though, like I said, we did not focus specifically on that.
Yeah, just one more quick comment. It might be helpful for us as we look at this, just for me, out of curiosity, is to put colored dots on these zones, let's say map 4, because that really does look like, to me, the better option, where middle schools currently exist. I think that would give us a better snapshot.
I think those are on the large maps?
Yeah, and it's on the web. It was on the web app too.
Is it on the web?
Yes,
The
ma'am.
web app, and on the big PDF maps we included, there's like a wall map that you could zoom in as a PDF.
That wasn't.
And it has all the schools on there.
Yeah, I'm talking about this map 4.
Yeah, we have,
it's on map
large
4.
maps of
Okay, I'll look
current,
for it.
yes, it's on there.
I'll look for it. Thank you.
But that map isn't up anymore, Ms. Vaughn.
What?
We don't have that map online anymore.
So could you provide that? Could you provide that
But
for
it's in
her
the
then?
packet.
Yeah, I'd like to see.
Yeah.
I'd like to see it then, please. Thank you.
Perfect. Thank you, Ms. Vaughn. Ms. Patrica?
A couple comments and then a question. Should the purpose of, on slide 3, should we include a statement of purpose about finding efficiencies? Like, that's not in the stated purpose, but saving money is really, I mean, I tell people all the time, that's part of the reason why we're moving to a proximity plan, is to save money. So I'd feel more comfortable if we just say that. Slide 12, and you don't have to answer this right now, Ms. Eba, but how are we going to go about securing the land necessary for these community schools? Are we working with the county to lay that groundwork? Are we working with municipalities? Are we working with builders? Because it sounds pie in the sky and wonderful, but I always tell people that land is not set aside to build schools when we build communities. So how are we going to do that? Again, you don't have to answer that now.
Well, I can at least say for some of our, we are starting to look at overlaying where our schools are and identifying those zones. That's why I was able to tell you where we know we have zones that are missing schools. So we are in the process now of identifying where those holes are, so that we can start identifying the properties that we should acquire in those zones. So it is something that we have already started working towards, and will continue to work towards it.
Okay, and I think the biggest issue for me is, I heard Mr. Malloy talk about getting out there and talking to the community. I'd like a second round of feedback before the board makes a decision. Because I remember talking to DAC specifically, and there were so many unanswered questions that they couldn't provide us with any meaningful feedback. To me, the meat of this comes in the policies. We can put maps out in front of people and they can ask you to redraw lines, but until we have those difficult conversations regarding grandfathering and potential magnet programs, or however else it is we're going to accomplish even distribution, despite the fact that we have resegregated ourselves based on where we live, I don't think we get meaningful feedback from the community. So I would like to see a second round of going out and presenting these plans to include the policy piece, gathering that feedback, and then coming in front of the board for a decision. I would be in a better position to explain that decision if I have to go out and sell it to the community. I'm not remotely close to that position right now. So I'm not prepared right now to make any kind of a decision and without more feedback. I guess that's really what I wanted to say.
Ms. Patrica, to that point, we have made a large amount of progress on the what you would call grandfathering or the phased implementation on the district side. So we are excited in 2 weeks to present where we are with that policy side. And I think, Cindy, you wanted to mention too.
Yes, and Ms. Patrica, in the timeline that you will see, we have a period after board approval of all of the drafts where we would bring an expanded group in, that we would get some more information from our principals, from our community members. They would bring those draft policies to you. We would take those out again to our community members, to our board advisory committees. So we have really 2 more rounds of getting input before that would be finalized. And then once finalized, we would have a big push out to the community to share all that information. But really 2 more rounds of input before there were final drafts available.
So 2 more rounds of input before we make a decision as a board?
Yes, we would ask you at our next meeting, do you want us to go forward? The next step would be we would invite a larger group. What we've been calling these our working groups. So we would expand those working groups. We would take the draft policies that we're going to share on the 30th. We would bring those into more depth, get some more specifics around those. So that larger group would be doing that. So that's the first level of input. Then we would take those recommendations out to the community and out to our board advisory committees, and that would be the second round of it. And then those would come back to you the following spring. So we would be asking for a final agreement probably late next spring, June at the latest. So we would have lots of time for input between now and then.
You good with that? Ms. Gittens?
Okay, couple of things. And I agree with Ms. Patrica. That was one of the things that I had. Taking it back to the community is kind of, I don't know the words to say, but we all know that there weren't that many people that participated. So one of my suggestions is, based on feedback I got from some of the people that did go, is they felt that when it was presented, there was already a decision made. And I know, don't jump to the conclusion, but that's what I was told, that they felt this is what we're going to do and we're just letting you know about it. So I don't know the answer to changing that perception, except whenever we hear about how you rolled it out and what you did, you very often start with, we went to this organization and this group and this organization. And to me, that's a top-down approach. Why not start the second round with a bottom-up approach? Go to the parents first and the, everyday people. Because when you've already gone to the businesses and the muckety-mucks and the people up at the top, those people feel like they're, out of their element. When you say, well, we've already talked to this group, but have you talked to me and it's my children that are going to go? So, and another thing that would create, when you break it down at the parent level, the basic level, then when you present it on the way up, it's not as eduquees. And you've got some of those simplistic answers. So that's one of my suggestions. Start bottom up, not that the parents are at the bottom, please, I'm not saying that. But instead of going to businesses and advisory boards and, CEOs in the county, go to the people first and find out what they feel, which means you're going to have to make sure they understand what it is you're bringing to them. I still maintain, looking at some of the slides, and I've said this before, that basing what we do on current need as opposed to future growth, and I'll just leave that out to marinate in the air. Couple of questions. I didn't notice the inclusion of the old Lambs building. And what are we calling that, Kathy? So I can stop saying old Lambs building. Is there a AA, a PQRST, or, Are there any letters? Can we assign it some letters or whatever? Because it's kind of out there, and I keep saying old lambs, and people get confused. So anyway, we can talk about that. But I didn't see that in relationship to some of those numbers. If it's not on the map, how is that? If it is, going to be additional seats, how is it affecting this whole process? And that may be something that you can answer later on. Okay. What was the other thing? On slide, there was one of the slides. Oh, one of the things was, I like M. I don't know if I really like M as broad as it is, but I can remember one time having to ride on a school bus. I think I was working it was at Lambs or Lehigh Senior, one of the two, and I rode on the school bus to take some kids that live at the bottom of M. You feel like you are going to Miami. And then you turn off of 82, and way up inside you find a little opening, and here's a bunch of houses. So for the sake of travel and transportation, yes, that is a very good idea to cut that off, because those kids were coming all the way up and going all the way to Lehigh and schools way deep inside of Lehigh. So I do like that idea. But the question I have with that, I know the piece of property that we've been talking about on 82 where Alico Road extension is coming, is that kind of the purpose of that, to encompass that M area? And you can answer it later, just kind of rhetorical questions, throwing them out. My question about the whole proximity thing has been from the beginning, if we're talking neighborhood schools and neighborhoods are not extremely diverse, how do we do it without transporting children? And if that diversity within that neighborhood encompasses more ESLs and level 1s and 2s, I'm kind of like, somebody convince me or show me, if we all live here in this neighborhood and the idea is to get us all to the same school so we can walk and we don't have to take a bus, how do we do that? And that is what I was looking for, the team or proximity or, you guys to come back and say, how was it done in other areas that you worked with? You guys have done this for a while. So something just as basic as saying, what's the nugget? And on one of the maps where you have H, I don't know which one it was, that had the big red circles, H was huge with, it was a huge red circle. So there's a whole lot of kids there. But then we also have to configure, there is gentrification, whether we want to talk about it or not. And a lot of those kids that you're showing in H right now are going to end up in K and L and M, because that's where they can go as we continue to build, high rises that start at $1,500 for a studio apartment. They got to go somewhere, and they're going to be going where they can afford. So I just want to make sure that we are all on the same page, and that we talk, when you talk to the parents and talk to the community, just that's the kind of stuff to talk about. So anyway, thank you very much for all you did.
Ms. Gittens, are there any other questions?
Go ahead.
Ms. Fisher?
So, I was just going to say, for the proximity plan part 1, I thought that the representation of data was really given careful consideration, and it opened my eyes in a lot of ways. And living in the Cape...
Fisher, could you please speak into the microphone?
Okay. Is that better? And living in the Cape, where you can't go from point A to point B all the time because of the canals, I I really appreciate sometimes the routes of the buses that I see having to go around blocks and this and that just to avoid driving into a canal. But the transportation, the commute time, and the distance, looking at these charts really was like, wow, okay, we knew this, but to see it presented this way was very helpful. One of the questions that came into my mind was, as we do this proximity planning and we have fewer choices in different areas, then what about the programs? And I'm sure that's another consideration that we're just not approaching yet, but I'm sure that it's on everyone's mind, especially our people in academics and student achievement. So I was a little bit surprised about the demographics, and although I see a lot of growth and building, especially in the north and northwest area of the Cape, there really aren't many kids. So our growth is unique to certain areas when it comes to the kids, and so I appreciated that you brought that out. That was really, I think, helpful, and will be helpful for any of our community who are going to be looking at this for in the future. I would love to see us, when we start with the parents and that, I would love to see us get a little bit more student input regarding the bus rides and the living near to people who don't go to the same school, and just get their take on how that has impacted them socially and emotionally. And then I think when we go for round 2 and on, you know, going to certain locations doesn't always render the kind of population and engagement that we want. So are we going to be using some different modes like surveys and texts and things like that? That would be my other question. But this was a great presentation, and when I looked at it before in preparation for today, I really was like, wow, I don't know what they're going to say, but I'm anxious for the presentation. So thank you very much. Thank you. Appreciate it.
Ms. Giovanelli?
Great. So this has evolved, right? I mean, it's coming along, so I think that's great. The question I have is, with the new census data, is that out? Has any of that data been applied to these numbers and stuff like that?
All the data I gave to you today regarding population was based on the current census data.
Well, let me be a little clear on that, actually,
Okay.
because some of these were estimates. Technically, I mean, I'm just getting a little tidbits here. Technically, the GIS portion of the census data was just released last week.
Right, I knew it was new.
And it actually is being vetted by individual states now. The government released it to all the states, and they're, without getting too technical, they're cleaning up things like incarcerated people. They can't have them, they have them in their prisons when they need to, the states need to adjust it to where they actually live or the communities are from. So some of the data is very, as Kathy said, is very current data. It might not be the census itself data, but it's very recent estimates. So it's fairly current, but the data is just now rolling in for the actual census data. I want to be clear on that one.
Great, thank you. So when we were out to stakeholders and so forth, have we talked to the county and the city and collaborated with them in any way, shape, or form as our planning process goes and getting their input?
Yeah, when I mean, we, as in my company, when we started this process, met with, whether it's in person or on the phone or virtual, met with all the communities and the county. We actually did some in-person visits way back, you know, from March and whatnot. Some of them are even on our committees as well.
Great.
So we got feedback from people in the planning departments from different communities, yes.
Great. And I know that, Mr. Malloy, you met with the Board of Realtors, and I'm sure they had a lot to say. So I think that's all good stuff. So thank you.
Thank you very much. And yes, you did great. All of you do great jobs. And even the ones that were here, you know, before that are no longer with us, did an excellent job being out there and speaking to the public. So thank
And I
you for
will
that.
say to that, I want to say, I mean, now it's my turn to return the comments back. Your staff has been amazing. Obviously, the current and even Dr. Savage played a huge role. The people that are no longer here working for the district, all extremely collaborative effort. It's been very pleasing to someone like myself who's been doing this for almost 30 years. You've had just an amazing team of people that have been very, and we had to change a lot of meetings, and are literally every week we're meeting at least 1 or 2 hours a week, almost for a year and a half. Imagine all the schedules that have to be shifted. Everyone chipped in, and it's been a real joy to be able to work with a lot of your staff.
Thank you, and thank you for sharing that with us. That's nice to hear. Appreciate that.
Just earned you no Uber back to the, I'll drive you back to the airport.
Lunch, we'll see.
Refrigerator for you.
No, thank you very much for being here. Appreciate it. And we will move on to our next.
I just want to say one thing to Mr. Malloy. As a former student of ours, I'm so proud of you. Thank you.
A proud stakeholder of the district as well.
Ms. Gittens, you have one more for them
Just
before?
one more
I'm
thing
sorry.
to say.
I'm so sorry.
I'm sorry, it's not a question, basically, it's a statement that as we, the governance team, look at this, we need to keep in mind as well that all of our schools, if we look at resources first for all schools, then doing the placement and who goes to that school is not as difficult if all things are equal.
Good comment. Thank you very much. We are.
Thank you.
Okay, so we are moving on to our next topic, which is going to be Dr. Savage, the agenda review. And I believe that
Yes, Madam Chair. We only have one question today that was submitted for our agenda review, and that is under G, Consent Executive Services, the approval of the 2022 legislative platform for the school district. That is under teacher retention. Are we able to add to this ask? Is this possible? We would like to see something changed regarding one-year contracts. At least put some responsibility in the district to make sure that new teachers are getting the training and support to be successful. And they should have some type of guarantee and security with a longer contract agreement between the district and the employee. We must share in making sure they are afforded the opportunity to be successful. Both parties agree that we share in that and support that and guarantee it with a longer than one-year contract. At least allow them the opportunity of stability. I don't see where we take any responsibility. At this point, who wants to be an educator for 1 year? One-year contracts do not entice career changers to become an educator. There is no stability or guarantees. They can be out of a job after 1 year. I would also like to longer-term contracts. This allows staff to buy a home and see more guarantees and stability with tenured teachers, with stability established in areas closer to their schools they work at. So the response that I have from staff essentially just advises that this would need to be a board discussion. And if approved, if this ask were approved by the board, then consensus of language would be needed to amend the current agenda item.
And Mr. Pre-Bruno, you have.
So also for the board's consideration, Florida Statute 1012.335 is the statute that dictates that it's going to be a one-year annual contract. So it would have to be a legislative change.
Right.
So I think that's what Mr. Giovanelli, I know you're the one who brought this before, so this is what you're trying to add this to the legislative priorities for them to make that change.
Yeah, I think it's important for the retention of teachers, the ability to have home ownership or even just stability in itself. And it's difficult to get a mortgage when they have one-year contracts, or especially if they're career changers, because then that's changing the field of their occupation and so forth. It would be difficult for them to get a home until they've had 2 years consecutive in the school district. And there's nothing that with that one-year contract just so keeps people on their pins and needles, of getting the highly effective and making sure they have this job next year. And it's not like that. They can be highly effective and still not get reappointed. So to me, it's always been a topic that I've talked to SPAC and TAC about, and it's across the board. It's not just, it's for staff in general. It's not just, I just think it's important. And I think try to fight for that. That's one of the things I would personally like to see. I don't know, maybe I'm the only one, but.
No, thank you, and I tend to agree with you too. So can we take a consensus on if this is something that we would like our legislative team to go ahead and include in our priorities. And that would be to add on to that one that we already have. Yeah, please, Ms. Patrica.
Through the chair, Ms. Juvenile, are you looking at adding language to the second bullet point under teacher certification and retention?
Well, I don't know if it's part of retention, and that's a conversation that we should have. I don't know if it should be separated out or kind of, I mean, they sneak a lot of things in. Why can't we sneak this one in? I don't know. I'm just,
Well, just from a realistic perspective, I get concerned about a legislative priority list that's too long. And so I thought that what we were saying and asking for local flexibility for teacher evaluations and pay for performance was longer than a one-year contract. So if you want to just add some language to spell that out in that bullet point, I would be happy to support that.
Oh, then, okay.
Ms. Gittens?
And I agree and kind of agree. I agree with the concept, and I agree with the fact that it should be. And I think I recall when it was changed to one, but the only concern I have, we've had this one piece in there for the last 3 years, and I am just a little bit squeamish of adding, unless we kind of hide it in there, because it could derail the testing piece if it's the testing and 1 year. So unless we have it maybe two separate thoughts within teacher retention.
Or could this come as part of the education portion, that we're trying to educate them?
Oh, that's a good,
Trying to do two separate?
because when they're explaining it, like Carol said, that they could say along with this the 1 year.
Okay.
Would you be
I'm
willing
open
to?
Whatever everybody thinks this would, possibly work, but even we may have to talk about it for several years before it happens, so I understand that too.
Can I suggest then in your, discussion of it that, Madam Chair, you get with Ms. Green?
Yeah.
To add to her discussion points as a part of this one that we already have.
Okay, thank you, Ms. Gittens. Ms. Fisher, did you have?
Yeah, I was just looking at this, and as we are saying that they have 3 to 5 years, or they have that 3 years to prove themselves, it would be good if they had a longer contract, and I think it is probably a contract issue and a negotiable issue at first. So I don't know if, necessarily adding it here, but I would definitely talk to Ms. Green about it and see what her thoughts are.
I'd be more than happy to do so. I'll forward this to her, actually, if that's what everybody's in agreement with. Ms. Vaughn?
Yeah, if memory serves me, I believe that ever since there was that change for the teacher contracts, that this has been on TALC's agenda. I know it has been in the past. And I think it's something legitimate to ask about. And I also believe that it would give some teachers security in that, trying to think of a good way to say this. There have been some teachers for no good reason were non-renewed by principals, and when I say no good reason, they were either effective or highly effective, and then because of personalities or whatever makes that weird thing happen, were non-renewed, and I think this would give more of a sense of security to teachers.
Well, that sounds great. So if you all are comfortable with me sharing this with Ms. Green and Ms. Ashley, that way they can look it over and see what's going to be best for us.
That sounds great.
Is that, everybody's okay with that? Yeah, thumbs up, consensus? Ms. Morgan, you good? You okay? Okay. I'll do that. I'll share that information.
Madam Chair,
Yes.
I think that was all the questions, but I do have one quick question, comment on item P1 that we're having a public hearing about. May I speak on that for a second?
Yes, go ahead.
Okay, P1 is the approval of the student progression plan, and the reason I'm bringing it up is that I received comments and emails, and I think it did get to the district and the superintendent as well, about some of the progression changes, and mainly that in some areas, and the example was with Algebra 1, I believe it was, and as we shift from what we're doing now to what we're going to do, there's a group of students that are kind of caught in the middle. And I can share this with you guys if you didn't see it. But for example, in middle school, if you, and I don't know if I'm saying it right, if you take Algebra 1, you couldn't take geometry. And there was a whole group of students that had taken the pre-courses and should have been able to go into the advanced class. But because the way this was written, they had to either repeat something they'd already taken, and the parents were calling and they were kind of, upset about it. So I'm saying that to say that we just need to be careful when we do make those changes, that we have some type of caveat to grandfather in certain students so they're not in a, kind of caught in a dark hole. And in some of the situations, it was in middle school, they were able to provide a course or put those kids in an advanced course. But just as a thought going forward, if we have anything like that, to make sure we've covered the in-between kids.
Perfect, thank you. Are there any other questions? Okay, seeing none, we are going to move on to our next, which is good of the order and comments. Ms. Fisher?
I have nothing this afternoon, thank you.
Okay, thank you. Ms. Giovanelli?
Actually, I sent an email out regarding the advisory committees, and I just wanted to bring up the fact that I have one, Ms. Vaughn has 2, Ms. Gittens has 2, Ms. Morgan has 5, Ms. Jordan, you have 7, and Mary has 4. Last year, I had 2. Everybody else had 4 except for Gwen, except for Ms. Gittens and Ms. Vaughn. They each had 3. The prior year to that is Ms. Jordan had 5, Ms. Fisher had 4, Ms. Patricia had 2, I had 3, Ms. Morgan had 2. I don't feel that the changes are equitable, and I brought that up in the email that I sent out, and it seems to be dwindling. So I don't know if anybody's thought about that, but I mean, I think we have to be fair and equitable and have to lead by the example if we want our students and staff to do the same.
I can respond to some of them. Well, Cindy's not here, but some of those are, I know some of the ones the chair is appointed to that, so you have to be on those.
There's 2.
The fair, nobody spoke on that. I'm just speaking on my behalf. So the fair, that's one meeting, and nobody spoke on that, so I just kept it again. Most of these are a 2-year. We're supposed to remain on these committees for 2 years. I did not remain on finance for 2 years because Ms. Gittens had an interest in that, so I stepped off of that so that she could sit on that committee, and I took whatever was left over. I don't know if you were not here, Ms. Giovanelli, when we were...
Yeah, I think you did it when I wasn't here.
We do it on purpose when you weren't here.
No,
It was
I understand
a
that.
scheduled meeting.
Yeah, I know, I think it was
Oh,
when I
okay.
was getting my daughter.
Okay.
Can
That's fine.
Ms. Gittens?
Just, I mean, and you know, in the past, I've had a question about that as well. Perhaps there's a more equitable way of doing it or just laying it out of, you know, here's the 2-year ones, here's the 1-year ones, here's the ones for the chair. And we all know that some are meatier than others. So I think to be equitable, some of those more, you know, heavy advisory boards or positions may need to maybe just in a rotation manner would be a little more equitable. So we had discussed this a long time ago and talking about how we could do it so that more of the governance team had more experience dealing with different advisory boards. And I'd like to suggest we may bring that up again. And then also, because Ms. Giovanelli wasn't here, you know, let's say if it was somebody else that wasn't here, I think that having more of a rotation type thing, if someone isn't here, they don't get, you know, completely left out.
Well, we can bring it back up at our workshop when we do the, our workshop.
Reorg.
Yeah, yes, when we do that,
When is that scheduled?
which will be coming up. No, I said we can bring this up when we do our meeting, that is our board meeting, when we do what our agendas are, what we want to speak about, we can bring this up on that day. If that's okay with everybody, we'll just add it on to that day. Ms. Giovanelli, will that work for you, for us to have that conversation on that day when we can have time to go over all that?
Sure, but I just think that we need to be looking at ourselves and making sure things are equitable and so I think that's just a real, you know, it's a real fact, so.
Okay, and we'll bring it up, give everybody an opportunity to look at what they're on and look at that sheet.
Is that, may I ask, is that going to be after the advisory boards have started? That will be like in November?
No, it'll be, we'll have a meeting that's coming up with when we do our own personal workshop that we do, that's that we had decided to do for our own personal, whatever we want to see come up, whatever we like, on one of those workshops, which is coming up. So yes, it would be before that. Ms. Giovanelli, sir, did you have any other for the good of the order?
No.
Was there anyone in particular that she?
Is there something that you want?
No, we can talk about it then.
Everybody has that before them.
Honestly, it's just really about the equity and the way things have been going. I think that's really important. You know, I just think we have to be leaders, that's all.
Okay.
Thank you.
Ms. Patrica, did you have anything for the good of the order?
Does the board want to act on masks today or not?
I am ready, prepared to act on masks today. I don't know if anyone else is.
Well, I think it should be an action meeting, though. I don't think it should be there's nobody here.
Well, Mr. Pre-Bruno,
And I don't,
can you please?
I think it should be tomorrow.
You can't take a formal action, you can only take it at an action meeting. You can certainly discuss it and try to get some consensus, but you cannot take a formal action in this meeting.
Well, I'll just follow up and say that this is not board action anyways. This is providing direction to the superintendent, which does not require a vote of the board anyways. We have never voted on masks, either requiring them or requiring them with an opt-out or not requiring them. None of the safety conditions or processes implemented in schools have been approved by the board. That we approved a policy that allows the superintendent to make this decision, so.
So
This isn't about public feedback, this is about safety and security and children's health.
And Mr. Pre-Bruno, did you want to
So the issue is that the superintendent has made a recommendation. The board certainly can take a consensus and advise the superintendent, but I do think if there's going to be a recommendation that is different from what the governor's executive order is requiring, then probably want to have it as a formal action.
Okay, so, but we can have discussion on it and then bring it back tomorrow for that. Because I, for one, believe that we need to make sure that everybody is safe. And that this is a public health that has, to me, it's not about parental rights, it's about making sure that everybody is safe. Ms. Gittens?
Well, the question I have, last year when we were in the midst of COVID-19 and as far as masks, we've never been in this situation that we're in the last 2 years. But when the superintendent had the task force for reopening schools and all of that, I believe it did finally come before us. It was and maybe I'm wrong, but we did discuss it. And I was told that it was the superintendent's right to do it, but we had many discussions and gave input on it. And at least we should do that, especially because of what Attorney Bruno said. I mean, we may all be liable. I mean, otherwise, we're either all going to get in the boat together or, just put someone else in the boat and let them float out. No, it's going to come back on all of us to speak up and make our decision.
Right, so we know by statute, it is the superintendent's right to do that, but as a board, we can
Right.
certainly decide this and have a conversation and bring it back to an action. And you're right, it does affect, but I'm okay with it affecting me. I just think that we need to move
I am
on this.
too, yeah.
Ms. Vaughn?
Actually, watch out for falling meteors. I agree with Mrs. Patrica that we need to bring it out. I, for one, believe, I think, Ms. Jordan, you said this is not a case of individual parental rights. This is a case of public school safety. And right now, we are facing something, if we had any doubt, just listening to the medical professionals and looking at those numbers and the fact that because there's no mask mandate, there are students whose parents did not opt them out and they go off to school with a mask and they come home without a mask because they don't feel any inclination to wear the mask. And the other thing, at the very, very least, and this would, I guess, be an MOU with the union, but I have gotten emails of parents that are upset because the teacher in the classroom is not wearing a mask. And of course, we can't ask, are you vaccinated? But I, for one, am very much in favor, although this is Florida, not New York, to do what some of the big cities are doing and mandating that, especially, it'll be very soon, that the FDA will approve the Pfizer and Moderna. And as soon as that happens, to mandate that people are either, that our employees are either vaccinated or they submit to weekly testing. And that's, if we don't get 100% with the kids, at least that's one thing, one safeguard that frankly we don't have right now. So I want to see a stronger line from us as a school district. I was looking at what Broward did. I think they have a great plan, and I think that there will be other school districts. Somebody starts the ball rolling, and you know, if we get defunded, I'll throw in some of my salary. This is important. So that's how I feel about it.
And we're not necessarily speaking about a whole year. We're speaking about.
I'm speaking about
we can keep
while
revisiting this.
because as somebody mentioned earlier, it's a little ironic because of the Hope Scholarship and kids, they can go to a private school, only the Catholic schools in this archdiocese from Venice, right, yeah, that all of them are mandated to wear masks until the, what's the word I want, the rate,
goes down.
Yeah, thank you. Rate falls down to 10 or below, and we are more than twice that level now. And from what we talked about, I predict by Labor Day, we may be at 30% if this keeps up. So I absolutely would want to do that for our children and our staff.
Thank you, Ms. Vaughn. Ms. Fisher and then Ms. Giovanelli.
So then, focusing on the masks, following the presentation we had today from our health experts, and knowing that we are having a public health emergency right now in this community and many others, and also knowing that the vaccine will protect you but not others, I really would advocate that we do take a stand and require, to the best of our ability, that people wear masks. I mean, I think that sounds like the most direct and positive way that we have to deal with this. That's in our control.
Ms. Giovanelli?
Considering, this is for Dr. Savage actually, considering Babcock having to close, we have schools that size that are, we have elementary schools the same similar size. So, what's the magic number that would require us to close a school? And then how do we attempt to make students wear masks if the teachers aren't? And that was already brought up. And I just think we need to be crystal clear on all our protocols for makeup work and stuff, and it all needs to be, across the district. So I'm sorry, I had several questions.
Ms. Fisher, did
Yeah,
you?
just one more thing. So regarding the parents' rights law, many different businesses are requiring their employees to wear masks. So I don't know that's not something that we can't do, is to require our teachers and staff to wear masks, and then, ask we have had, I think, a majority of people that have contacted me by email or phone or text have said, please put masks on the kids. Yes, and the teachers. So I think that with a little bit of effort and a firm, unanimous stand from this board, we may at least increase the number of masks being worn and diminish the risk to our people.
Thank you, Ms. Fisher. And I believe that the executive order was only pertaining to children anyway, where, if I'm correct.
The DOH order was definitely pertaining to students. Two caveats I just want the board to just have that in the back of their mind. The suggestion made by Ms. Vaughn with regards to a vaccination or submit to weekly tests, as well as the mask requirement for instructional staff personnel. Obviously, those are changes in working conditions which would have to go to the union, obviously.
And Ms. Giovanelli, did you have something else that you?
I think she might have just answered it. I think she just answered it. Because my concern is, how do we encourage vaccinations? Or how do we require someone to wear a mask that may be vaccinated? And, and obviously we can't, during HIPAA, we cannot, show me your card. So, there's just all those technicalities that are legal issues that can arise. So I just think we have to this has to be thought out.
Ms. Morgan, I know we didn't hear anything from you. Did you have any comments or anything to share?
No, I don't. Thank you.
Okay. So then this is something that, I don't know, Ms. Patrick, if you would like to bring it back up tomorrow?
Yeah, I have to say, may I?
Yes.
I know, I received a text immediately after Dr. Savage made the mask requirement, and it said, "You have firmly placed yourself on the wrong side of a political issue." I just want to say to the 6 of you that I sit here with, this is not a political issue. For me, this is, I don't know how else to keep our children safe when you have the head of infectious disease for Golisano come in front of us today and tell us that masks should be worn in our schools. Masks should be required in our schools. When we were here last year trying to reopen schools, we were all about science and following the science and listening to local experts, local doctors with regard to what was best for our kids. And I don't feel like I can stop doing that now just because the political pressure or the political rhetoric surrounding this issue has gotten stronger. This is not about a power play or it's not about, you know, going after the governor or any of that. For me, this is literally a matter of having 95,000 kids, 13,000 employees that we need to protect, and receiving medical advice from very well-credentialed, experienced, and successful doctors telling us this is what we should be doing. So I just wanted to make that clear to you all, as my colleagues at the table. Thank you.
And I don't, and thank you for that, Ms. Patrica, but I don't believe that anybody up here is thinking that it is a political aspect in any way. I certainly am not. And to me, it is like, why last year we went through the same thing, which was less than what it is now, and we did what we had to do to keep everybody safe. We need to continue to think about that and do what we have to do.
The other thing that I will tell you is that I had, I'm sorry, just really quickly, I was on a call today with, what's his name?
Cordova.
Dr. Savage Cardona. Secretary, no disrespect, and he was very, very, very supportive of safe reopening plans and the use of ESSER dollars to accomplish that exact goal. So it was very clear where that support would come from. So that's it. I'm done.
Thank you. Ms. Morgan?
Yeah, so it seems to me there are one or two things we need to do. One, we're going to either direct the superintendent to initiate a mask requirement, or we're going to adopt a resolution as a board that we support a mandatory mask requirement. One or the other. I mean, let's just cut to the chase and do this. We want to do something tomorrow. Let's talk about what we want to do.
Okay, so Ms. Gittens, and then we'll go ahead and.
Well, basically, haven't we already said, he's already said that. Superintendent has already said that, you know, children will wear masks with the opt-out caveat.
Without that.
So that's, I guess, where I'm, you know, if you want to speak on that, Attorney Bruno.
So I think if I may, I think what we're trying to say, or I know myself and I'm thinking it's the majority are trying to say that yes, we understand that he put this mask mandate in place, but it's that mask mandate with option out. We're saying mask mandate, no option out. Until a set time where there is not, that we see these numbers going down and we revisit it. We're not saying it's for the entire school year. We're saying let's try to make sure that everybody is safe. Let's make sure our teachers are safe, the staff is safe, the bus drivers are safe. Everybody is safe and they can stay in school and get educated. That's what I think we're saying. Am I hearing that right, or am I misinterpreting?
That's all right.
Okay. And Ms. Giovanelli, is that what you're hearing, or? I think she's.
My question was never answered. What's the level of infection? Would we have to close a school? I think that we need that. Those are conversations we also need to be talking about. You know.
I'm happy to answer that question first through the chair. But just Ms. Stillwell, if you don't mind kind of hearing the conversation on this one as well. So one of the daily communications we have is just monitoring the level of what is happening, the transmission in our schools in terms of who is calling out. So Ms. Stillwell, can you just kind of dialogue through under what conditions would we close a school, or would we consider a closure of a school, or be directed possibly to do so? Because I know the Babcock example was brought up.
So per the Opening of schools for this year, it stayed the same as last year. Individual school closures will be recommended based on the number of cases, the percentage of teachers, students, and staff that are positive for COVID-19, and whether there is secondary transmission. Individual school closures may be appropriate when there are multiple cases in multiple cohorts at a school or when greater than 5% of the total number of teachers, students, staff are absent within a 14-day period, depending on the size, physical layout of the school.
Ms. Giovanelli, does that answer your question?
Mm-hmm.
Thank you very much, Ms. Stowell, for reading that piece to us. Just to kind of comment, if I may, on just this piece, and maybe how I am trying to approach this from the direction I'm hearing. I just want to make sure we know that, a year ago when we were taking the action we did, we were still trying to also operate within the letter of the law from how we, both for the DOE in terms of our delayed start date. We still opened in August, the latest possible date. We did have the mask mandate, which at the time there were no sanctions. While I certainly would agree that any type of sanctioning that's offered in the form of salary or withholding funds or any of those are just sanctions. I think the part that I just want to make sure I've highlighted is and based on my understanding, when the governor makes an executive order, that is the law. So this is not, in my mind, any type of political rhetoric, as much as I would just say that as a constitutional officer, to directly defy our governor of the state who was elected, much as you all were elected, that is not a simple decision to make, to say we're going to ignore our state elected governor's direction to us that specifically spells out from a legal standpoint what we can and can't do. My attempt to make the recommendation for the mask requirement, but honoring the opt-out, specifically was done to try to take it under advisement, all the medical advisement we received, which is that masks do make people safer, that community transmission is very high, and so thusly the recommendation I put forward was attempting to honor what the medical experts had told us was necessary to do, but also to stay on the side of what the governor had issued, as well as the Department of Health, our state Department of Health that made the issuance with him, along with our Department of Education. So all those came out on the same day. It was attempting to be responsive to that, also following precedent with what Hillsborough and Orange had done. So while I understand Broward's been an example, they have gone the extra step. As well as Alachua, I believe, also did in terms of the medical waiver piece. That, again, does go against the executive order, to my understanding. I think it's my obligation as an executive to just make sure I've highlighted absolutely that is, it's not so much the sanctions that I think would cause any pause, it's just going against what I would say is the law on this particular piece. Now, we can certainly say that our opinion, after hearing from our head of our pediatric infectious disease, that mandating masks would make us safer. I'm not disputing that in any way. I'm just saying that acting responsibly on this piece, I think either of the two options provided by Ms. Morgan to say either directing me to do this as a board or to adopt a resolution, I think either of those would send a clear message that we have evaluated that. We're well aware of the law as it's been kind of stated. And again, Attorney DePree-Bruno, please clarify if I'm incorrect on that. I do work at the pleasure of the board if directed to do something along those lines. I just want to make sure we're all aware that there could be repercussions if we were to go against what the governor has stated very expressly, which is you are not going to be able to mandate masks in your schools for the aforementioned reasons. I just want to make sure I've stated that as well.
Mr. DePree-Bruno?
So Ms. Morgan's suggestion of a resolution is probably the best course of action, that tomorrow somebody make a motion, however the board decides, and have the discussion and have the vote, because there will be legal repercussions, not just the governor's order. I'm sure there will be other things. So I highly recommend a formal vote on this particular topic.
Yes.
Ms. Gittens?
And how long will it take for us to get a resolution done? Or should we?
You could just somebody make a motion tomorrow, second it, have your discussion, open it up to public comment, close it with your vote.
Okay.
Okay. Ms. Fisher?
Yeah, I have a question for Attorney DePree-Bruno. So the U.S. Constitution is commonly referred to as the Supremacy Clause, and it established It establishes that federal constitution and federal law generally take precedence over state laws and even state constitutions. So how do you address that?
I agree with you. Usually, the United States government, in terms of federal law, would trump. And in this particular issue, it just depends on what specifically we're talking about. In this particular case, I know that we have two different appellate opinions on this in the state of Florida, and I know that there's a lot of gray areas in terms of whether or not the executive order was a law, because was it passed during an emergency, which is what the statute requires. So there's a lot of gray in this. So if the board is choosing to move down that path, then that's fine. The board can give the directive to do that. There's nothing wrong with it. But we want to be prepared, and I know I need to be prepared for any of the legal ramifications that I'm sure will be coming forthwith as a result.
Ms. Patrica?
So
I'm sorry, Ms.
can we ask, not that everybody's going to vote for it or against it, but can I ask you to bring forth a resolution tomorrow as a good cause item so that it's legally worded and it'll be part of what's discussed? Please. I mean, I don't want to just make a motion that might not be technically worded legally correctly. Every other resolution we do is prepared in writing for us to consider.
Okay, so if the board directs me to do that, then I will draft one up.
Okay, let me ask Ms. Morgan.
Yeah, I do have one question. Having done this once before where we went against the state, we did find out that our bond rating was in jeopardy. So I would appreciate somebody checking with our bond folks to make certain that our taking this kind of action doesn't threaten us financially in that regard. Thank you.
Thank you for that.
Do we need to
So
say
do we want-
something as far as directing Attorney Bruno?
We could take a consensus on directing Ms. Dupree Bruno to come up with the resolution as Ms. Patrica has just requested, and for Ms., also, if you would please check on what was just mentioned by Ms. Morgan, that would be great. And do I have consensus for Ms. Dupree Bruno to do all of those? And Ms. Giavelli, how do we get you to change your mind in having her come up with that?
Consensus, but I'd like to hear all the information, so.
Okay. But you're okay with her going forward and checking that out for us?
Sure.
Okay, thank you. Okay, thank you, Mr. Bruno. Is there any other comments? Seeing no other comments, this meeting is adjourned. Thank you. We'll see you tomorrow.